spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year,
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible
to save as many lives as we can.
Together, we can win this race.
For our patients,
for our elders,
for ourselves,
for you, for us,
for our community,
por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
And I'd like to invite the clerk to conduct the roll call. Supervisor McGorty. Supervisor McGorty. Sorry, present.
Supervisor Mulhern.
Here.
Supervisor Hashak.
Here.
Chair Jurdy.
Present.
And Supervisor Williams.
Here.
Hey, I'd like to invite Supervisor Mulhern to lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right, thank you. Next on our agenda is first of all, I'd like to announce that item 5C is being withdrawn at the request of the department, and then go to public expression. Members of the public can comment on items that have been submitted online at telecomment or call in now and provide comment. We're going to limit comments to 10 minutes per topic. Okay. Do we have any public comments on non-agenda items?
Dr. Duhan, you are on the line, and you may begin.
Tell her Dr. Korn is.
Dr. Korn is not on the line.
Well, hello, this is Dr. Duhan. I think Dr. Korn was going to be making the presentation. I also don't have access to you seeing me visually, but that's okay. I think maybe we should delay till Dr. Korn can log in.
Dr. Duhan, this is CEO Angelo, and the COVID update is not this week as I thought it was. So that's why we're asking just to do public comment. So Dr. Korn is not on. So if you could, as Deputy Health Officer, give an update, please, a very brief update. And we're hoping that our hospital partners will get on. And if not, we'll have them speak later. So thank you.
Of course. So I'm happy to do that, CEO Angelo, and our Board of Supervisors. Let me just say that, in this surge conditions, I'm speaking right now extemporaneously without notes. So I'm going to give you my brief thoughts off the top of my head. Okay. So to share with you, we are in a Delta surge. We're calling this the fourth surge. It's also being called by the state as the surge of the unvaccinated. Regarding Delta, we cannot get whole genome sequencing anywhere in the state for the majority of our positive tests, but we know based on fact and evidence that Delta is the dominant variant in our county based on what we're seeing. So we're anticipating it's 90% of the cases that we're seeing now are the Delta variant. This variant is highly infectious. It's more like chickenpox in terms of infectivity than the wild type or original COVID infection, highly infectious. And also vaccinated people, unfortunately, can get infected with this Delta variant, actually with all of the COVID variants, and they can transmit to other people, in particular unvaccinated people, this COVID infection. So vaccination is not a complete protection for us because we can still get sick with COVID and we can still pass COVID to other people, in particular unvaccinated people. The great news about the vaccine is that it prevents, in people who are vaccinated, it has a very protective, preventive action in terms of death, and hospitalization. So in vaccinated people, there is a strong benefit of the vaccine against COVID, but it is not a complete prevention. And unvaccinated people, as I said, we're considering this to be the surge, the fourth surge of the unvaccinated. What we're seeing right now in Mendocino County is quite alarming. We're having an acceleration of cases, an acceleration of hospitalizations. We're starting to see deaths now rise again, which, as you know, is a delayed impact of COVID infection. The vast majority of the infections, hospitalizations are in unvaccinated people. I see that Dr. Corrin is on the line now, but I will say to you that our hospital system, I'm believing we're going to be hearing from them, is stretched thin. So the bottom line is that people are advised to not gather, particularly inside. Outside is protective, and do all the other things that Dr. Corrin's been advising, wearing masks, social distancing, staying home when sick. Unfortunately, in Mendocino County, based on the strong work of our CICT team, we know that many people who are sick with COVID are going to work sick. They're going to gatherings sick, and they're spreading the disease widely in our county. We are also surrounded by other counties that are being heavily impacted by COVID now: Lake, Sonoma, Napa, Solana. So we are in a very difficult situation that is similar to the winter surge. I'll hand it over to Dr. Corrin.
Thank you, and I'm sorry I was not checked in at 9. And Chair Jurdy, members of the board and CEO, let me go through some of the data, but we are going to get to a presentation from the hospital. And as Dr. Doohan was explaining, we are in the 4th surge at this point with a much more contagious and deadlier Delta variant. This one is more threatening to Mendocino healthcare system than the prior surges. So the average with a 7-day lag of our cases is 37.5 per 100,000 per day. This is 6 times higher than just 1 month ago. Total cases now number 5,267. In the Latino community, it's 2,299. And the deaths now number 55, 5 more than last month. Let's see. With low testing, again, a better estimate of severity is the hospital admissions. And at this point in the hospital, we have 27 patients from Mendocino County, 3 of whom are out of county. We also have 2 additional who are coming from out of county. We have 21 patients in the on med surge, but 6 patients in the intensive care unit. This is significantly higher hospitalized cases than we had last winter and spring. So we've had a lot of the hospital staff have been burned out, many not accepting extra shifts as they were doing last year and the early part of this year. So this is clearly a hospital crisis brewing based on staffing. In this regard, California has just released the mandatory vaccine verification or weekly testing order for healthcare workers. And this causes some concern about the staff leaving, but in the long run, its implementation will undoubtedly protect the vaccinated staff and their patients. An additional concern at this point are schools opening. We are seeing more symptomatic children in Mendocino County, and the state has already been reporting more pediatric hospitalizations and deaths with this Delta variant. So transfers are going to be in a greater demand in our region and throughout California, but we are probably leading in terms of regional problems with our ICU availability. So we have been meeting with our regional partners and discussed contingencies. There's the new state order from yesterday to require reporting and facilitate transfers and other mitigations when for 3 days a hospital intensive care unit availability is less than 20% of staffed beds, or regional ICU access is less than 10%. Rancho is now at 22.7. That's our health officer region. So it's 22.7% available ICU beds. And in Mendocino, Howard Hospital has no available ICU beds, while AHUV and Ukiah Valley and Adventist Health Mendocino County, Mendocino Coast, each have 25%. So altogether in Mendocino County, we have approximately 18.7% of our intensive care unit beds available. So we have asked Dr. Howe or Judson Howe, and I don't know if he is on at this point. We've asked him to come and report on the hospital situation as part of this report. Does the clerk have Judson Howe?
No, Dr. Corrin, we do not have either of the contacts from the hospital on the line.
Okay. they just texted. Let's see.
Well, Dr. Corn, Supervisor Williams has his hand raised.
Yeah, a couple questions. Dr. Corn, how do we fare compared to the rest of the state? Are we winning or losing?
Well, it's not a competition, but Rancho is probably in the worst situation.
And when school opens, I imagine we will see an increase in the surge. How much latency do you expect there from when school opens until we know the effect?
It's not clear. We have a lot of mitigations in place, and a lot of the schools are testing all their staff before they even come in. And they're going to be testing the staff weekly. The students, some are also testing them before they come in. Let me just see, I got a text back. Okay, so Hudson House should be in soon. The delay would probably be 1 to 2 weeks when we see positives start showing up. It might take a week for that to show up, but with the increased school testing, it should be relatively soon, within a week or two. So I have an understanding of that. Has Mr. Howe signed in yet?
No, once they're pulled in, or once they're on the line, we will pull them in, but they have not arrived.
So maybe I should just continue for a little bit. Let me just say that we have had 3 small outbreaks that were well contained by employers or apartment managers. There are still many high-risk exposures, as Dr. Doohan was explaining when I came on. These are in bars and restaurants predominantly, and other retail establishments where people going in with minimal or no symptoms are driving the community spread, and it runs through their families and out into the community. We've seen as many as 95 cases coming in a single day. That has stretched and stressed our CICT team. And at the same time, the state withdrew many volunteers because a couple of months ago, they thought that we were beyond this surge. We're now contracting to replace them, and we're in the interim and probably ongoing, supplementing the non-public health county employees who are again being brought back in to work on this activity. I see that Mr. Howe is on right now, and perhaps I should turn the floor over to him if I can, to explain the situation with the hospitals and also at this point the bed availability in the county. We're not getting your sound, Judson.
Your audio, Judson, isn't working.
Can everyone hear me now?
Yes. Great.
Was that a yes?
Yes.
All right, thank you. Well, hello, Dr. Corn, Dr. Doohan, the Board of Supervisors. I appreciate the time to provide an update. We will be having our Chief Medical Officer, Dr. Basant Parker, joining me here in just a moment. But I appreciate the engagement from the county. As Dr. Corn has just expressed, the pandemic is actually reaching pandemic highs here as we move into mid-August. As of the other day, we actually reached a peak of about 27 patients in the hospital with COVID that met inpatient criteria. I'll share some numbers in just a minute, but I do want to start off with really kind of the macro narrative first. And that is, we are starting to see some significant fatigue. Although I do want the community to know that it's still safely staffed, but I do want to share just an emotional connection, and that is, there is some fatigue as we move into 18 and 19 months of this pandemic. We are seeing about 85% of our admissions are non-vaccinated members of this community. And, obviously that has a certain emotional attachment, but we're professionals at this and we're here to serve everyone in the community, both vaccinated and non-vaccinated. But that is an very important piece of this pandemic that I would like to share with the community. Currently, though, our peak was over the weekend on Saturday and Sunday. There does seem to be a lag from community events of about 6 to 7 days. That could be coincidental, not causal. But we are seeing a slight decline from that peak over the weekend. So as we speak, we have 24 COVID patients in the hospital, down from that 27 that I mentioned just a moment ago. As a result of that drop, and actually as a result of us restricting surgical cases, we do have bed availability as we speak. We have several beds in Ukiah and 75% capacity on the coast. Our incident command meets every day at 11 a.m. And as this phase of the surge, we are starting to coordinate in different ways across all 3 campuses and trying to function as one organism providing acute care to the entire Mendocino community. And so I really want to say thank you to our community partners around transportation, MedStar, also the Adventist Health Mendocino Coast also has some rigs and the ability to transport, and we've been working through those resources as well. Also, the county has modified some of its practices around behavioral health transportation as well, which has freed up transportation, which is one of the things that we need in this county to be able to load distribute COVID patients across the county, whether it be if someone presents in the Ukiah ER, perhaps head up to Howard or vice versa. And when transportation is taken up by behavioral health needs, non-medical needs, it does impair the ability to transfer. So as of this time, Dr. Corin, as of today, as I speak, we do have ICU bed availability. We do have the staffing that we need. And as needed, we do have the ability to reach out to high-cost agency resources in Sacramento to tap into there. And as those are exhausted, we can move into a third phase, which would be to work more closely with the county and the state on state resources as well. But as of this time, we're actually investing more into our existing labor force. And as Mendocino County always notices, people do respond, and we have been able to fill our shifts through the week. That being said, looking at your numbers, Dr. Corin, it looks like the case rates are continuing to climb, and hospitalizations tend to be a lagging indicator. And so we are planning and preparing for safely receiving those cases into the ER as they come through, probably in the 3 to 4 days from now range is what we would expect based upon the pandemic to date. I see Dr. Parker is still trying to join. I can maybe turn over to you for some questions. My ask of the community would actually be, we can actually make some infectious disease experts available. I know Dr. Corin's made himself available, but for the nurses and the clinicians, the respiratory therapists, the imaging techs, the physicians of the hospital, we highly recommend that this community reevaluate the appropriateness of the vaccine in their life. It would really resource the hospital and allow us to continue to provide COVID care as well as other critical care inside of our perioperative spaces. So for example, as we cancel very life important cases in our surgical spaces because we need those resources for COVID, that is someone that is delaying or canceling care that could save their life. Thank you, Dr. Corin. I'll turn it back to you for any questions you might have, and I'm happy to answer those.
I see a hand raised from Supervisor Hatchak.
Thank you, Chair Jurdy. So this is a question for either Judson or Dr. Corin. We're vaccinating down to what age at this point? Is it 12 years?
I'll take that, Chair or Mr. Hatchak. Yeah, we're the people who are eligible now are all who are over 12 years old.
Okay, and of the cases we're seeing, are we seeing the age drop? You know, because before it was a very, mostly elderly, and now are we seeing that the younger people are getting it? The Delta?
Hey, yeah, Supervisor Hatchak, I had actually lost my audio there for a bit. I am back now.
Yes, we are seeing younger people in the community who are getting affected. in the range of, say, 49 to 65 rather than the 65 plus. But we are also seeing more symptomatic children, which I don't have an exact tally of, but we're definitely seeing that. And as I said before, in the state, we're seeing more hospitalizations and also some deaths. And in the country, that's the pattern that's happening.
So considering that, you know, and that the children under 12 years of age aren't being vaccinated, we're still, you think that the precautions we're using in the schools are sufficient to ward off a surge at that level?
Well, we do have universal masking indoors for all students, staff, including faculty. In addition, they're trying to increase the ventilation the teachers, of course, the staff are under orders to show verification of vaccination or an acceptable exemption. And if they are exempt, they're still going to have to test every week. So I think we should be able to hold off, and that's the prediction by the state authorities, that should be adequate mitigation to get everybody back in school. I mean, I think we're going to see what happens over the next few weeks as schools open, and the state is ready and willing to change or modify its recommendations if that becomes necessary.
And last question is, have we asked the state for additional help if that's needed?
Yes, we're talking with them and have obtained more help with CICT, and they're arranging that. It is something that because they've ended their state support, we'll have to pay for it. But they do have a company that is able to help us with staff, and I think that there's another company that they've helped the hospitals with that they can get staffing. In addition, we're using more resources for testing, and we plan to put on another traveling team for around the county. And we so far have been doing okay in terms of the vaccine, which is good because the vaccine demand is increasing, but we could utilize some state resources if we need to for increasing vaccines. What's come on board that has been a significant increase is private pharmacies are getting a lot of requests for vaccines, and they have them on hand. And so the private pharmacies are also giving vaccines along with the clinic partners, which are arranging them. And we are continuing to make vaccines available through the fairgrounds and also out in with the clinics and also in we have some pop-up clinics and working with the schools. We're working very closely with the schools to increase vaccinations there and prepare for when the 5 to 12-year-old age group becomes eligible for the vaccines.
Supervisor McGordy.
Question is for Dr. Corrin. So, Dr. Corrin, what's our overall vaccination rate in Mendocino County as far as you know?
Yeah, so as of the 9th, which is the last time the state published the data, we have distributed 97,400 doses, which is 73.9% of the residents over 12 years old have been at least partially vaccinated, or 63.4% of the total vaccination who've been fully vaccinated. And also, it's noteworthy that we've given 4,000 vaccines in the last 2 weeks, which represents an increase in demand, which is a good thing.
And where do we stand on mandatory vaccinations for different parts of our employment sectors?
So the schools have a requirement to verify vaccination status, or if staff this is for staff, or if they are exempt, then they can get tested once a week. The hospital healthcare workers have a mandatory vaccine requirement, and that's from the hospitals all the way through clinics. And again, there's an exemption, and if they are not verified to be fully vaccinated, they require testing. We do have a fairly good uptake. I was just checking it, in the range of 85% of our skilled nursing facility staff are also vaccinated. And we have made a recommendation, and the county is requiring verification of vaccine status for our county workers, or if they are exempt, the ability to be tested on a regular basis. And we will be releasing a county recommendation for all employers to begin a requirement to verify vaccination or offer testing. And we have just released this week an order for our emergency medical technicians, EMTs, fire, first responders, all to also have a verification of vaccine status, or if exempt, those people can continue on weekly testing.
Well, it sounds like you're trying pretty hard to cover it, and it looks like we're making some progress, but there's still more room to go. And this question for Mr. Howe, when people come in for doctor appointments, are they being recommended to get vaccinations if they don't have them? Just curiosity.
Yeah, I mean, they are. The primary care physicians are educated on the need for the vaccine and the benefits of the vaccine. And I will say that we have a very high percentage of vaccinated physicians in this community. I think inside of Adventist Health, it's north of 95%. And so a lot of times they lead by example and really communicate that they're doing it to themselves, and they recommend it for their patients as well. Dr. Parker, I don't know, I see you're on now. Did you have anything to add to that?
Yeah, and we offer it in the emergency rooms as well as when we're discharging patients. So we are offering it at all sites and all portals of entry and exit in our system.
I think that's really important, because the doctor-patient relationship has a high level of trust in most cases. So I know myself personally, I often don't bother with flu shots, but when I go in to see my physician, they lay it on me pretty heavy. You know, you're over 65, you better get a flu shot. So I've started doing that on a regular basis, where formerly I wouldn't have thought about it. So hopefully this will help increase the number of vaccinated people, and thank you for what you're doing.
Thanks.
Supervisor Williams.
What is the current vaccination rate for Adventist staff, county school staff, and County of Mendocino staff? Can we quantify those three?
Yeah, so for Adventist staff, on average, for our three facilities, we are right around 70 to 75, depending on which facility.
And that was before the mandate, correct, Dr. Parker?
That is correct.
And the mandate goes into effect, end date to be compliant is September 30. Of course, to start the course of vaccines, you need to be getting that first vaccine if you're doing the Pfizer and Moderna here in early September. And religious exemptions and medical exemptions are due on August 20.
And Dr. Corin, are we tracking for county?
I don't think we have that number at this point. As the HR rolls out their requirements, then we'll have people verified, and then we'll know more.
And similar answer for schools. Are we able to work with MCOE to capture just so we can start tracking?
Yeah, and they are supposed to report to me soon. So, but I think it's in the range of 70 to 75% of the staff as well.
Thank you both.
Chair Jurdy, this is CEO Angelo, and to that question, we are tracking the number of county employees and the departments that are vaccinated and not vaccinated. That is something we are doing. And since Dr. Parker is on, would we like to give Dr. Parker just a few minutes to update the board as well, please?
Sure. I just wanted to hit on a few highlights. As we all know, the Delta variant is raging and much more than the previous time when we had the novel virus. What we are seeing in our emergency rooms is that the regular emergency room volume is still there, unlike previously when people were afraid to go to the hospital because of the coronavirus. Now they are coming to hospital, regular volumes, and added to that, we have the Delta variant spreading very fast, and lots of COVID patients presenting to our emergency rooms. We have had an unprecedented number of COVID admissions compared to November, December, when we had the high uptake surge in California, when our total number of patients would be around 16, 17. This time around, it's double. We have about 30 or so in our 3 hospitals, and it's fluctuated from 25 to right around 30. So that's what we're seeing. It speaks to the different nature of this virus and perhaps the seriousness of this surge. We are no more as sheltered as we might have been previously. What are we doing about that? We are currently safely staffed for the current volume. We do have capacity if we are to fully deploy all the levels of our surge plan. We currently are in phase 1 of our surge plan with our flex unit. The flex unit has 11 dedicated rooms for COVID. We have gone as far as using 8. Now, we have had more numbers in the hospital than the 8, but keep in mind that some of them may be in the ICU. And we have 8 ICU beds in Ukiah and 4 and 4 in our other 2 hospitals, making it a total of 16. So we are in phase 1 of our surge plan deployment, utilizing our flex units. We are adequately staffed for that. We hope that we don't get to deploy all the various levels, which would include basically opening up and closing, opening up all spaces and closing down everything. And that could potentially give us almost double our capacity of 100, going on to 180 to 190. So that's as far as we can go. Currently, our normal capacity is 100. We haven't hit that yet. But we stay prepared to be able to operate at our capacity. And if we have to go beyond that, we would have to draw on other resources within our system and perhaps state resources if we need that. So that's in a nutshell where we are at. Currently, we have 75% of our ICU on the coast, that's 3 out of 4 available, open. And in Ukiah, we have 25% of our ICU capacity available currently, which is 2 out of the 8 available. In Howard, we have used all our 4 ICU spaces. But one thing I need everyone to keep in mind is that this is dynamic. So it's 9:35 right now. By noon, we may have a few discharges. Potentially, some people can be stepped down from the ICU to the regular medical surgical unit, and then it may create some capacity in Howard. But at the moment, we have 5 ICU openings currently. I'll pause here for any questions.
Thank you, Supervisor McGordy. Supervisor McGordy, do you have your hand raised?
So to all of the medical staff here, what are kind of the kinetics of this this phase of the disease? What do you kind of expect based on what's happened in other places for continue rise of infections based on our population numbers and the infection rate.
Dr. Corrin, you want to take that?
Well, we are seeing steady rises. Northern California seems to be, unfortunately in the forefront with many more of our hospital resources being occupied. We don't have as many as other areas in the state. And so what I would foresee is that if our surge continues to increase, we're going to require more transfers to other places in the state. And there are some counties in Rancho that are actually worse than we are. And so we have accepted some patients from them. And the new order that I was describing a little bit before does require mitigation in terms of transferring and also accepting transfers. So I think that we'll be set with that. We've talked with our EMS providers, and they seem to be prepared at this point. I did note this morning that a team of 5 ambulances was sent to assist on the Dixie fire, so that could present problems as we go forward. But we do have good resources here. But I do think we're going to probably have to spread some of those ICU patients to some of the other counties as we go forward to maximize the quality of care. Another question that we wanted to ask you about, Basant, was the current preparation for pediatric patients. So I wonder if you could speak to that.
Yes. So our normal process with pediatrics is that when they come into the emergency room, we have them evaluated, and if they need to be admitted, we admit. We have pediatric hospitalists that are dedicated to only inpatient care 24/7. And we care for pediatric patients on the medical surgical unit. We do not have a dedicated pediatric ward. And it's also important to note that we do not have ICU for pediatrics. Our ICU is an adult ICU. What we've done with respiratory illnesses like RSV, which tends to be serious in the kids, and some of them needing high levels of oxygen or needing intubation. If they need intubation, we stabilize them and then we transfer to the specialty children's hospital in Oakland or UC Davis. So those are the avenues for high level acuity pediatric patients. Mild to moderate acuity, take care of them right here.
Okay, thank you. Supervisor Hashtag, do you have a question or comment?
Yes, thank you, Chair Jordy. I heard that in Del Norte County that their surge was kind of correlated to the fair that they had, and that there is similar concern in Humboldt County, that there is a correlation. In Covelo, they canceled the Blackberry Festival that was supposed to happen this weekend because of their concern for COVID. So I was wondering if there's any guidance for some of the fairs that are coming up that's going to be coming out from the county.
I will field that. At this point, I'm not planning to disallow those kind of fairs, but when they have contacted me, I've given them some advice, and the recent festivals and fairs that have been able to do this, we've requested and they've complied with vaccine verification and testing. And I think we averted a significant problem up in, I think it's Laytonville, the Black Oaks, and they have a yearly festival there. We've had some increase in the last week, but I wouldn't say that it's directly related to that. There have been other cultural events, and they've usually coordinated and done very well with the masking and requiring entry at entry, either vaccine verification or testing. But I think as things get worse, we may want to curtail some of those cultural activities, and we'll be considering that as well as some of the other high-risk activities, such as larger gatherings, and then also where we're seeing a lot of the transmission happening is in restaurants and bars. So down the road, we have ways to mitigate this, but we're trying not to use industry-wide heavy-handed closures, rather advice and trying to work out some best ways to mitigate.
Okay, well, thank you for the update and sobering news. Do we have any, do we have any other members of the public wishing to comment on non-agenda items?
Yes, we do. Next up will be Brent Blazer.
Brent, you're on the line and you can go ahead and unmute and begin whenever you're ready. Okay, it appears that Brent is experiencing a holdup, so we're going to go ahead and go to Katrina Bartlome.
Hello, can you hear me? Hello?
Yes, we can hear you. Please continue.
I'm sorry. Yeah, Brent Blazer, Mendocino County OES. Thank you for your time today, board, supervisors, and Carmel. Just kind of wanted to give you guys an update on the PSPS issue, the essentially the public safety power shutoff. Currently, the county has been issued, I guess the National Weather has kind of issued a red flag warning from 11 p.m. today until 8 p.m. tomorrow evening. So essentially, this PSPS is being driven by offshore winds. And so we're going to experience localized winds in certain areas where PG&E is projecting to turn off the power to prevent any sort of fires and such. Initially, the scope was 669 customers. Now it's looking to be 1,138. This is going to be a moving target as we get closer to the actual weather event. Right now, it looks like the areas that are going to be impacted are going to be Redwood Valley, Covelo, Potter Valley, Leggett, Laytonville, Cummings, Cloverdale, Gerberville, Boonville, Yorkville, Branscombe, Wittenthorne, and Willits. I'd like to really kind of stress that there's a projected outage map. So there's outage maps that PG&E has created in partnership with a lot of the local jurisdictions. And so you can actually see where they have current outages, and then they also have another button that you toggle on that you can see where they're projecting outages to be. And for our county, the highest numbers are actually in Redwood Valley, Laytonville, essentially the Yorkville area. Those are kind of our bigger areas that have projected outages. At this point, we've kind of done some outreach to all of our partners. We've also done some public safety announcements and such, warning the public of what's going to happen, and then also some safety tips. PG&E is also doing the same thing. We've also requested community resource centers. Right now, we're looking at one in Laytonville, but now that the scope has expanded, we've kind of asked her for some additional resources. As those become available, we'll advertise them to the public. And of course, if you look at the outage maps, when the PG&E commits to a particular CRC or community resource center, they post it on the map as well with the hours of operation and such. So I'd really encourage, we sent out a lot of this information out yesterday to our partners, links on how to prepare, how to get notifications, all those things. So we want to make sure everybody has as much information as possible. The last thing I would just really encourage is that, a lot of people are going to start using generators and such. Please practice generator safety. We put out some information about that. We just hate to be in a situation where we have additional fire starts due to generator usage and such. Pending any questions, that's really all I have for today. And I apologize. We were kind of working on some bottled water issues for the drought impacts also.
Brent, I see an email that you sent to us this morning, and it mentioned there's 1,138 customers that could be impacted by the power shutoff. But then it goes on to mention several communities that together would be more than 1,138 customers. Does PG&E's map indicate what portions of those communities would be impacted? Is it that precise?
It isn't that precise. And some of the biggest challenges are that, and I want to recognize the fact that PG&E, the public safety rep, he actually is in my office right now. That's how committed they are to making sure we have the best information we can get. The challenge generally tends to be that when they refer to customers, we're talking about meters at residents. And sometimes a meter can be multiple residents, right? It could be, multiple customers on one meter, if you would. So essentially, the numbers vary wildly. The information that we get from PG&E, we try to share it as transparently as possible. However, the numbers can really fluctuate up and down. Right now, like I mentioned, our biggest impacts being, say, Redwood Valley. There's looking at like 234 meters in that area that could be impacted. Laytonville 223, Yorkville 145. Branscombe 132. A lot of the other areas like Potter Valley are looking at like 88, or Leggett 35. So a lot of them they really trickle down after to lower numbers. And what we do is we just try to look at where the areas that are most impacted, and if they're more rural in nature, we try to make sure we get some type of community resource center or some type of support to them, or that it's in a relatively shortest possible commute time for them. And again, a lot of it is just making the ask and seeing what PG&E is able to support.
Yeah, thank you. Any other questions, Brent Blazer? Okay, thanks for the update.
Hey, thank you. Have a great day.
It looks like Katrina is on the meeting.
Good morning, Supervisor, CEO Angelo, and County Council Christian Curtis. I wanted to give you an update on the signature verification for the cannabis referendum that we've been checking. On July 20th in the late afternoon, we received 6,239 unverified petition signatures. To date, we have checked 3,098 of them with 2,527 valid ones. So we have 870 additional valid signatures to check. We're not sure how long that's going to take. We're, of course, with all the departments, we're shorthanded and we're doing it as quickly and as efficiently as possible. We've had a lot of addresses that don't match. We've had other people completing the signature part that the voter would sign, and that's an invalid signature. We've had several duplicates. We've had several that no residence address, and that could be where they put a PO box, a personal mailbox, or no address at all. We've had a few no signatures, which I think only two. You fill it all out and then you forget to sign it. We've had 5 so far that were removed by voters before the petition was handed in, and we've had a few that didn't turn in their registration papers, voter registration papers, until after the petition was received by our office. So we're checking them. We have 30 days. We have, I think we've gotten into 18 business days that we've been checking these signatures. So we're progressing, and I would imagine within the next couple of weeks, we will be complete. So I just wanted to give you guys a heads up of what was going on and see if you have any questions.
Supervisor Heshak.
Thank you, Chair Judy. Thank you for that update. And Katrina, let's see. So it seems like there's 2,500 verified, 2,527 actually out of 3,098 that were checked. So that's like 5 out of every 6 have been valid.
I think about 18% of them have been, well, we've got, you're probably right. I didn't do that math, but that sounds about right.
And so they need, what is the total that they need?
3,397, and we have 3,100 basically left to count to get the additional 870 that we need.
Yeah, so if they kept that 5 out of 6, ratio, then they should easily get the required number.
That's what we believe.
Okay, thank you.
You're welcome. Okay, if you guys have any questions, you know where I am and you can contact me. Thank you.
Thank you for the update.
Next on the line will be Patrick Hickey.
Good morning, Chair Jurdy, members of the board, CEO Angelo. Patrick Hickey, field representative with SEIU Local 1021. And I'm here today with a congratulations and a concern. These are obviously unprecedented and challenging times, simultaneously addressing the pandemic, the drought, and high fire danger. And this obviously requires all hands on deck. The congratulations is in recognition of the 3rd increase in county salaries that was recently implemented, that has gone a long way in bringing Mendocino County employees closer to parity with other similar rural counties. This has helped stabilize staffing and reduced the hemorrhaging of staff to other counties that were paying significantly higher than Mendocino, and this directly benefits the county and helps us retain experienced staff. The concern I want to raise this morning centers on the vacancy rate in many of the county's departments. We will not be able to hang on to talented employees if they are drowning trying to manage an untenable workload. In some areas like roads, short staffing can actually be dangerous. We know there are many reasons that the county is having a hard time with recruitment, not the least of which is the fact that we have a 37% vacancy rate in human resources. But this is an emergency that must be responded to as such. Most of the vacant positions are not being actively recruited. Just to cite a couple of the numbers from the CEO's report from today, mental health, we're looking at a 51% vacancy rate, public health, a 43% vacancy rate, public health nursing, a 45% vacancy rate, WIC, a 52% vacancy rate, Department of Transportation, 31%, planning and building at 26%, child support services, 38%. Those departments just cannot function with those high levels of short staffing. We're also looking at situations, like environmental health, where those are revenue producing departments, and every staff member that's not actively working is a staff member that's not bringing resources into the county and is not providing the services and the oversight that they are vitally needed to do. If we don't get these departments and units closer to adequate staffing, we risk losing the benefit of the stability brought on by the salary improvements. We know your plate is beyond full, but directing focused and aggressive recruiting will enhance the county's ability to do its essential work. So I do urge you to send that message to human resources and to the executive offices. Thank you.
Supervisor Williams. You're muted.
I support what Patrick just recommended. I don't know that we can afford to fill all the positions. It may be that some positions are not actually market because nobody applies. But I think we should step up the recruitment process just to get more data. If we step it up and still no applicants, we can come back and talk about it. What is the appropriate venue to discuss this? Is it the General Government Standing Committee? Is there an existing ad hoc that could look at it? Can we just ask HR to do it?
Well, could certainly ask the CEO, but I think if it was a committee, I think that's the General Government Committee would be the appropriate committee to look into it.
Chair Jurdy, this is CEO Angelo. I concur with what you're saying, the General Government Committee, though we can do another update to the board, a more in-depth update on the vacancy rate in the departments. I would say that what our practice has been, so this board knows that there are some positions that are ongoing, the recruitments are ongoing, and certainly other departments that while they may have an issue with their budget, that we certainly do promote that they recruit, because we know if you have 3 vacant positions, you're going to be lucky to fill 1. I'm not convinced it's the salary and the benefits, because I do think our benefits are exemplary. Salaries, we certainly can do another salary review at some point. I'm just not certain who's out there as far as people that have the particular expertise for some of these positions. Certainly, if you speak with Director Gonzalez in the planning department, the planners are, that is an expertise that is needed throughout the state with vacancies in every county. I do believe that we can take a look at the direction of this board, offering, maybe there are some areas, some things that we can offer that other counties aren't, that could put us just a cut above to be able to recruit. But if this board likes, we can either do the General Government Committee and start there, or we can do a full presentation to the board. Thank you. Whatever this board wants.
Supervisor Williams.
I'll put my hand down.
Supervisor Hashak.
Thank you, Chair Jurdy. I think that a full presentation to the board, because I think there's a lot of issues that go into recruiting and filling these slots. And so I think that the full board should be apprised of what the situation is and to try to come up with ideas on, like workforce housing and some of those kind of ideas that go beyond the scope of just salary and benefits.
Okay, so looks like there's a lot of interest in this. I think we should have this on a future board agenda for the full board, for the public to hear. And so we'll work with the HR department and CEO's office to get it on the agenda as soon as possible.
Thank you, Chair Jurdy.
Do we have any other public comment on non-agenda items?
Yes, we do. The next caller on the line is Anne Marie Weibel, and she is commenting on 9C.
Hello. According to the settlement agreement that you adopted during closed session on July 13, you voted that AT&T will have to apply for a post-approval and post-construction CDP without having had to apply for a pre-construction CDP. The Coastal Commission made it clear that AT&T needed to apply for a CDP first before the stop work order would be lifted. You voted to rescind the stop work order and give AT&T the permission to string the remaining aerial fiber on the 50 poles that were installed along Navarro Ridge Road in Albion for 3 miles and connect them to the communication facility on the Lord's land. We have stopped the actions twice before because it is just not okay that AT&T can threaten the county with legal actions if they don't get their way. The workers informed community members that they could never install aerial cables in Napa or Sonoma County. Why here in Mendocino? Why was AT&T allowed to install this eyesore in the scenic coastal zone? The Coastal Act calls for widest opportunity for public participation. These closed session backroom deals exclude the public. This project is setting a precedent for corporations to roll our county government. On 8/13, Environmental Health Trust, Children's Health Defense, other groups and individuals won an important appeals court case against the Federal Communication Commission. Based on this information, it is high time to rewrite Mendocino County's wireless guidelines, just as the FCC's regulations from 1996 are outdated. So are Mendocino County wireless guidelines from 2015. Please, no more closed session, backdoor approvals when the public is not informed and not involved, and AT&T just does whatever the heck they want to do. They did not inform the Planning Commission about these aerial stringing of fiber. They did not inform them about the poles, and they did not inform the public. And it's just a horrible eyesore. If you would have seen it, you would not have voted for this. And please, no more votes like that. It's not acceptable. Thank you so much.
Next on the line will be 8 voicemails regarding item 4E.
Hi, this is Diane Nickel calling about fire safety issue from the gun club. Now, they've been shooting and starting fires for the last many years, and we need you to help us stop this fire starting techniques with fire, sparks from guns, and wind. Our homes are in danger. It seems like you people don't care about us. I know there's reasons, but maybe they can use their guns in the winter time when it's not high fire danger. The whole neighborhood is upset. We're all looking for you for help. Please help us stop this craziness. It's high fire danger. They start fires every year. It takes resources away from other fires. Thank God we have CAL FIRE, but we need your help now. Please stop shooting at the gun range during high fire season. Or they should be digging a line around there and putting some kind of safety measures in that they can't spark a fire. Just like a lawnmower sparked a fire in Redwood Valley. Please, please, please help us. Thank you.
My name is Lourdes Lopez. I'm an attorney representing Busy Springs Resort and speaking on the consent calendar matter 4E, which is an agreement for a shared exercise of land use in California Building Code Authority. I submitted a letter to the board with my objections to the proposed agreement today. Busy Springs sees speaks and strongly supports the county's efforts to regulate the gun club property. This has been our primary goal in the pending litigation. However, we do have some concerns with the agreement. Number one, the issuance of the building permits by the city is not a common power with the county under Government Code Section 6502. The city does not have the power to issue building permits to the gun club, a private club. The county should issue the building permits, as this would be more consistent with the Attorney General opinion and more coherent process. Number two, even if we assume the city has power to issue building permits, prior to issuing any building permits, the county should be consulted and the
One moment, Chair Jurdy. It appears that the voicemail playback is cutting out.
county should provide confirmation of whether the construction is permitted under the county zoning and land use laws. To the extent the county building codes are laws. To the extent the county building codes are more protective of its citizens or inconsistent with the city's building codes, the county building codes should apply. Number three, the agreement should provide that the county will apply. Number three, the agreement should provide that the county will Hi, this is Diane Nickel.
Yes, my name is Paul Lazarevich, and I'm calling in regard to item 4E for Edward. And I'm calling in regards to the gun club. I live at 2370 Apollinaris Drive, directly across from the gun club. And I haven't complained much in the past. I've lived here for 20 years, and several fires have been started over the years that I've lived here. Not to mention two in less than a year, less than this year. This is obviously a safety issue for our community and the Eastern Hills. Another issue is that there's no real cutoff time. They have a vague time of a half hour before sunset, which is often ignored. I think it's time to have some type of oversight on the gun club. And I thank you for listening.
I am calling regarding item 4E for the agenda on August 17th. My name is Eliza Giacomo, and I'm calling to recommend the approval for item 4E. I'm calling with concern to the ricocheting of gun bullets from the gun club to the healing center and the spa at Stitchy. I have used it many times. I have hosted out-of-town guests. I have appreciated the beautiful opportunity it's been for people from out of town to come and to experience it. Me and my family have retreated there many times, and the traffic and the gun noise and the
Hello, my name is Patricia Longstreth. The item number is public expression. My husband and I have the following concerns regarding the Ukiah Gun Club. Number one, fire, especially in conditions of high probability. There have been many over the years, including the one last week and the one in October last year. 2, ricochet bullets, including the one that penetrated a window of a homeowner on St. Glory Court and others found along Bishop Springs Road. 3, there are no trained fire marshals present at the gun club. 4, lead contamination and lead dust. 5, noise pollution, which has substantially increased over the years and into the evening hours. And lastly, the county should not give away its permitting authority to the city of Ukiah for building permits because county citizens don't have a voice about their. My name is Lourdes Lopez. I'm an attorney representing Busy Springs Resort and speaking on the consent calendar matter 4E, which is an agreement for a shared exercise of land use in California Building Code Authority. I submitted a letter to the board with my objections to the proposed agreement today. Busy Springs seeks and strongly supports the county's efforts to regulate the gun club property. This has been our primary goal in the pending litigation. However, we do have some concerns with the agreement. Number 1, the issuance of the building permits by the city is not a common power with the county under Government Code Section 6502. The city does not have the power to issue building permits to the gun club, a private club. The county should issue the building permits as this would be more consistent with the Attorney General opinion and a more coherent process. Number 2, even if we assume the city has power to issue building permits,
Chair Jody, this concludes 10 minutes of public comment on this subject matter. Would you like us to continue?
If the rest of the calls could be just forwarded to our emails.
Absolutely.
Would any board member have any comment on this item? Supervisor Williams.
Can we ask Christian or County Council to comment on the last caller's expression?
Certainly. Mr. Chair, would the board like to just take up item 4E separate from the rest of the consent calendar?
Yes, I actually would. Yes, I would like to pull it because I think that we need to hear a little bit from both Christian on the genesis of this JPA and also from Building and Planning Services about what are realistic expectations for the county to do in the future.
Okay, so we'll take up this item separately with the consent from the other consent calendar items. Okay.
Excuse me, Chair Jurdy. We do have one more public comment on a consent item. It's a different consent item.
Okay, go ahead.
Item 4P, and it will be Julia Krog.
Hi, good morning, Supervisors. Julia Krog, Assistant Director with Planning and Building Services. I wanted to make a comment regarding a discrepancy on agenda item 4P, which is for the approval of the 2020 annual progress report related to the housing element. The discrepancy is on table B within the document, page 5 of the PDF. And table B is auto-populated by Housing and Community Development and is showing the regional housing needs allocation, which is known as the RENA number, for the 5th cycle as opposed to the 6th cycle of our housing element. This is a locked column that cannot be edited by our office, so our consultant contacted HCD and learned that due to an oversight, they have not yet entered in the county's 6th cycle RENA numbers into their database, and therefore the 5th cycle numbers are showing on the spreadsheet on table B. This does not affect the APR submittal to Housing and Community Development, but we wanted to be sure it was clarified for the board. Everything else in the APR is correct. And I do have the correct numbers for table B, which I will just quickly run over. And these relate to the final allocation. So for very low income, 291 units, low 179 units, moderate 177 units, and above moderate 702 for a total number of units 1,349, which is the county share. And this is documented within our housing element. We just wanted to make sure it was clear to the board about that discrepancy, but that it is not an issue related to our actual compliance for the annual progress report. And I'm available for any questions. Thank you.
Thanks, Julia. Looks like there's no questions. Supervisor Hashak.
Yes, thank you, Chair Judy. It's a process question. Is according to the chair's meeting outline, 4F and 4E are being considered separately. So are we dealing with the consent calendar now? And if so, I'd like to pull item 4A.
Okay, let's discuss 4A.
Well, on item.
Chair Jody, I'm sorry to interrupt. We do have one more voicemail to play for public comment for consent calendar.
Okay, great.
My name is Patty Clark. I'm calling with regard to agenda item 4F. Greetings, supervisors. My name is Patty Clark. I'm a member of the Redwood Valley MAC, speaking only for myself today. I wish to point out that the only reason PG&E settlement monies were sent to the county, the only reason you get to choose how they are used, is that neither Redwood Valley nor Potter Valley are incorporated. If they had come directly to Redwood Valley and Potter Valley, I am certain we would have allocated them to meet the still unmet recovery needs of our residents and our communities. I understand why you might want to redirect the $22 million that PG&E paid. It's a lot of money, and it could do a lot of good in Mendocino County. The problem is, it's not your windfall to do it as you please. You made a point of having community meetings with residents of both areas, but you didn't take seriously their requests. The Redwood Valley MAC sent a letter detailing its priorities, which seems to have had little to no effect. Supervisors McGordy and Mulhern, I believe you were there when Redwood Valley resident Sarah Shepard, who lost both of her children and her home to the fire, told us that she has 70 acres of standing burned trees on her property, tinder for the next fire, a horrible reminder of everything she lost, as well as a terrible risk for the whole community. The Natural Resources Conservation Service has a program to help with this, but they have limited funds, and homeowners are required to match funds. These projects can cost tens of thousands of dollars per acre, and matching funds are generally 50%. Many property owners in Redwood Valley and Potter Valley are struggling with standing dead trees, and you allocated only $500,000 for hazardous tree removal. All told, allocations that were specifically noted as being for Redwood Valley or Potter Valley, including our fire department and water district, are only 16.5% of the total $22.652 million. I'm going to say that again. Redwood Valley and Potter Valley burned, and you only allocated 16.5% of the total PG&E settlement fund to specifically help these communities. I beg you, vote no on agenda item 4F and begin the whole process again with adequate public discourse. Thank you.
That concludes public comment.
Okay, let's go on to item 4A.
Okay, thank you, Chair Judy. So with item 4A, with the minutes and agenda item number 3 of the minutes, and it says that general consensus of the board to direct staff to work with Supervisor Mulhern and return on August 17th with an item regarding the state law requiring that department heads are personally responsible for the department's budgets. And so I don't see that on the agenda today. And it seemed like I guess I'd like an explanation from county council about how that happened, because the consensus of the board was to not implement this state law, and that we didn't want to go in that direction of holding these department heads or elected officials accountable for overages, that we were going to deal with it as a budget process. So I'd like to understand where we are with that from county council.
Chair.
Well, what hear from county council first, then from Supervisor Mulhern, because it was her item.
Thank you, Mr. Chair. I did work with Supervisor Mulhern on this. I drafted some language and a resolution, but quite frankly, getting the right language has proved a little bit elusive, and we weren't able to get something together in time quite quickly enough for this meeting. So it had to be pulled and set for the meeting on the 31st. As I understand the board's intent, essentially the board does not want to be pursuing actions against department heads for routine overages that would otherwise be addressed through budget adjustment processes, et cetera. The only thing is finding the right language for that wouldn't be contrary to state law. I thought I had something, and after reviewing it with the budget team and the auditor, I found out there were nuances and some difficulties that I didn't quite capture. That would be a little bit more complicated. So, my apologies to the full board, but I'm going to need a little bit more time to be able to capture that correctly.
Okay, Supervisor Mulhern, would you have anything to add?
No, thank you, Mr. Chair. I was going to address this during supervisor reports. So thank you. I believe that Councilor Curtis covered it.
Okay, Supervisor Williams?
Yeah, I don't have any issue with the discussion, but 4A is approval of the minutes. The question is, do these minutes accurately capture what happened in the meeting? I don't think we're following the agenda.
Supervisor Hatchak, do you have any issue with the minutes?
Well, I do have issue with if the minutes showed that there's supposed to be direction of it coming back on this meeting and it's not coming back, I'd like to know where it is. And so I think that again, the direction of the board was to not implement that mandate from the state. And I'd like to make sure that everyone is clear on that.
Okay, well, we have now heard an update. Any other comments related to the minutes?
Yeah, I do have another. And on agenda item number 4, it says that general consensus of the board to direct staff to return with an item on August 17th, 2021 to explain the scope of creating a standing committee consisting of Supervisors Haschak and Mulhern to deal with general ongoing cannabis issues. And Supervisor Mulhern had not accepted that position. And so I wanted to be clear that it wasn't, the standing committee was not consisting of her at that point. So the minutes don't correctly reflect what was happening in the meeting.
Supervisor Mulhern.
Thank you, Chair Jurdy. Yeah, so there was a discussion at the board. I went back and reviewed the item, the videotape, and it is definitely my interpretation that Supervisor Haschak and I were going to work on what this might look like with County Council and come back. So I agree with Supervisor Williams. The minutes are the minutes, and then when we get to the item that is the agendized item, then we can talk about it. But I want to follow the agenda in the appropriate manner.
Okay, Supervisor Haschak.
Well, I just think that when it says that it's creating a standing committee consisting of Supervisors Haschak and Mulhern, that wasn't what was supposed. That wasn't what the conversation was. Supervisor Mulhern had declined that and wanted to further investigate whether she wanted to be on the committee. So I think that that should be reflected in the minutes.
Chair Jurdy, this is Atlas Pearson, Deputy Clerk of the Board. If I might explain our interpretation of that directive.
Go ahead.
So the directive that we did capture was general consensus of the board to direct staff to work with Supervisors Mulhern and return on August 17th with an item regarding, oops, sorry, wrong one. Here we go. To direct staff to return with an item on August 17th to explain the scope of creating a standing committee consisting. So the item was just to not necessarily form that right away. It was to direct the staff and Supervisor Mulhern to work together and to discuss what the scope of such a committee would be, and then come back and possibly create it.
Well, I think that since it is an agenda item today about the creation of the standing committee, item 5D, I think we can go on. I think the minutes are a little confusing.
Okay. And just a reminder to all supervisors, if they have issues with the minutes, they should bring those up with staff in advance of the meeting. This back and forth here really isn't necessary, in my opinion. If you would do that in advance of the meeting. Supervisor Hashak.
Yes, I did bring it up beforehand, but since we didn't see the minutes until they're published, then it's published and we need to deal with them as a published document.
That's true. However, you can also address this issue with the staff in advance of the meeting. And if there's concurrence, you can just simply announce that there's been a simple update. Staff's concurred. We don't need this back and forth at each of these meetings, and it's getting a little old, I gotta say. All right. Any other issues with consent calendar? We have items 4F and 4E. Supervisor Mulhern. You're muted.
Thank you very much. I don't have an item that I wanted to pull, but I wanted to mention about item 4C is a proclamation regarding the 101st anniversary of women's right to vote. And there is a celebration August 21st from 1 to 3 p.m. in Mendocino on the Kelly House lawn on Albion Street that the community is invited to attend.
Thanks for that announcement. Any other items? We have items 4F and 4E that are being pulled for separate consideration. Would anyone like to discuss item 4F now? Supervisor McCarty.
So on 4F, there's some I guess community dissent in Redwood Valley about spending the funds, and I think it's kind of difficult to try to go back and redo everything. We can't. I mean, I think we had a fairly robust process in terms of involving all the supervisors on ideas about how the money should be spent. You know, I really would have done it a little bit differently. I would have started more with a public hearing that would have involved the people who are actually affected by the fire. And I think Mo and I tried pretty hard to reach out to get ideas, and we brought quite a few in, and we did make some adjustments. One group that was left out, and I think they have a legitimate issue to be included, is the Grange Hall, because during the fire, it served as a very important center for the community in many ways. It continues to, and it's a building in need. And I would like to somehow find a way to include funding them to improve their infrastructure, because it is a community resource for Redwood Valley. They don't have a lot of places where you can have meetings, and you know, I think it would really help a lot if we were to consider providing money to upgrade your facility. There's that. The other thing I'm not quite sure of, and maybe Darcy can explain to us if she's available, the situation on hydrants. I've kind of lost track of which hydrants are being installed and what the expense is on, or what we're planning to spend on fixing hydrants, or if we've identified other sources of funding, because obviously having a source of water during a fire emergency is extremely important. And then finally, the other thing I'm not quite sure about is the removal of hazardous trees. That's something that I also am concerned about. We can't obviously take care of some 77 acres of burnt up trees, but I think, if I understand it right, that some of the funds that we provided were for removing hazardous trees, at least around residences. But I'd like kind of an update on that, if anyone understands the proposals that were put in and what might be provided via fire safe councils or other groups that we've agreed to fund.
So I don't know if Darcy or if you or if Tim or someone else from your work group is ready to speak. I did ask for Tim to prepare a document that would show the total amount of money that the county has secured for Redwood Valley and Potter Valley in response to the fires. And I think it'd be helpful if they went over that information as well, because it's pretty substantial. And in fact, it needs to be included in the discussion with PG&E.
Tim Hallman, Principal Analyst with the Executive Office Fiscal Team. We did prepare that list for you last night. And again, it's not comprehensive. You can go ahead and take a look at that just to see where funding has come in. As to the fire hydrants, I'd like to defer to Sarah Pierce. She has where the funding is going as far as the alternate sources for coming in and providing those fire hydrants. If you'd like to speak with her, she is available here.
Supervisors and CEO Angelo, Sarah Pierce, Principal Analyst within the Perm Department. We did pull the fire hydrants totaling 950,000, and we have applied those to the ARPA funding.
So they are covered then. So we are planning on taking care of that as part of our ARPA plan.
As far as, yes, as far as we have reviewed the guidance and it looks like it's an eligible cost. I don't know if Darcy has any other further comments.
I can't, can you guys hear me?
Yes.
Yep.
Oh, hi. Good morning, Chair Jody, Supervisors. Yeah, Darcy Ansel. So at this point, at the last meeting, just before the last meeting, we were able to remove the fire hydrants and put them towards ARPA. So it's looking good that the ARPA funding will be able to cover that 900,000 for the fire hydrants needed in Redwood Valley. Some of those are in the reconstruction zone where we're putting in the water line through Howard's team at DOT, and Bulgy and Race as the contractors. So we'll be adding fire hydrants to that. And then there's some additional fire hydrants at the request that will be going in as well. And that total Redwood Valley water project is close to 9 million. And by the time, you add the fire hydrants, that'll be a good impact in that community to get that water line back up and stable.
I have a question for Tim. Thank you for putting together this document late last night. I'm not sure if it went to everybody on the board, but am I reading it correctly where it shows total projects awarded is some $22 million to Redwood Valley, Potter Valley?
I'll go ahead and let Sarah talk to that one. She did finish the preparations on the totals there, so hang on.
Sarah Pierce, Principal Analyst within the Perm Department. It's not just the awarded grants. We have pending grants that are noted there too. And the FEMA obligations that we have received. So, but yes, the total. I'm
Sarah,
sorry.
can you share that document with everyone so we can see it?
You want me to share my screen?
Yes, please.
One moment.
So this would be the FEMA obligations as well as grants that the Disaster Recovery and Perm Department have been looking for and seeking since the 2017 fire.
So this top section is the awarded grants. And then we have a few pending grants. And then this was an other award. It was not a grant. MROC was able to disperse a little over 2 million in grants to provide individuals with immediate relief, critical needs, and rental assistance. And then this section down below is what FEMA has obligated so far. And the total is a little over 22 million, almost 23 million. And I can go back up to the awarded section. And as Darcy had said, there's close to 9 million that has been awarded, and we are in progress of completing for the Better Valley Water District.
Sarah, as I read it, whether it's the awarded grants, the FEMA obligations, all the funds awarded to recovery in Rhoda Valley, Potter Valley, equal about 17.5 million. And then there's another $6.5 million in pending grant applications. So I just think it's important for the public to know that the County of Mendocino responded to these fires. Other issues obviously were put at abeyance and not dealt with because of the recovery efforts in Red Valley and Potter Valley. And it was a trauma for those communities. Certainly, anytime anyone loses their home, it's a trauma, whether it's one house or 100 houses at one time. And I'm really proud of the work of the county employees to bring in $17.5 million. And with these PG&E funds, in addition, there's the board has allocated another $8 million to those neighborhoods, those communities, and then another 10 million plus for countywide preparedness for the next emergency. And as we've seen this summer already, the emergencies were, fire emergencies are very likely to be in those same communities again. So to the extent that we're building capacity for the community to respond to emergencies, it's really assisting those communities as much as any other community in the county, perhaps more. Supervisor Hashak, you have your hand raised.
Well, thank you, Chair Judy. Along the lines of this funding that we approved the other week, and it's being brought back, and this request for the Grange, I did get a couple additional requests from fire departments. The Little Lake Fire Department, which is, there was some miscommunication about what they really needed to do to make the proposal. And so they didn't get it in on time, and they really need an update on their Type 3 wildland engine. And that would be about $370,000. And they were part of the response to both the Pine Mountain area and Tomkai roads. So during the fire, they were integral in that part, fighting the fire. And also the Brook Trails Fire Department has a need for a wildland squad, which is $249,000. And these are both crucial for fighting the fires and preventing the fires that went on with the Potter Valley Redwood fires. So I'd like those to be considered too. And I sent those into Assistant CEO Pantel and Analyst Tim Hallman.
Supervisor McGarty.
So I'm wondering, a question to the board, how do we handle this? Do we want to open up an extension for considering use of some of the PG&E funds? I'm very supportive of trying to help the Grange get their necessary repairs, because it truly is a community resource. And they did make an application. I'm not sure if they missed the deadline or what happened, but somehow it got lost in the shuffle. I know that they wanted to be considered, and they still should be considered as far as I'm concerned.
Supervisor Williams.
So I fully support more funding for fire. There isn't a fire district or fire company in this county that doesn't need more funding desperately. I guess I'd like to see us do it holistically, looking at the actual need, where the need is, what the level of support should be, and then look at one-time and ongoing funding. I'm a little bit worried about putting fire up against fire of who can get an application in the soonest or knows who to contact on the board. We ought to look at the problem as an entire county. I would imagine most or all fire departments participated in the larger incidents. That's the nature of, during a fire, resources are pooled.
Well, in fact, I think virtually every single fire department in the county did respond to these fires. I mean, I on mountains east of Ukiah, I saw a fire truck attended by a volunteer from Elk. So, they were all there on the scene, not just Brook Trails, not just Little Lake Valley. So I think personally, if we're going to consider additional requests for the fire departments, I would like to see a comprehensive review as suggested by Supervisor Williams. The deadline came and went. We did have a request in, I believe, from the Grange, so they did submit the application in a timely manner. Supervisor McGordy, what did you have in mind for the Grange to follow up?
So I believe that the request was for $250,000. I would like it to be reconsidered by the board along with the fire departments, which again, I support as well, because it's pretty clear that it's a pretty thin line that separates us from disasters. And certainly already in my district, 2 times this year, we've had some close calls. And so I appreciate that. But I also want to recognize the Grange as being a really important community resource in the 1st District in Redwood Valley, because we don't have a lot of public places, and it's used heavily and it's literally falling apart in some cases and needs repairs.
Okay, Supervisor Hashak.
This would be a question for Assistant CEO Antle. Is how much of our money from the PG&E funds has not been committed at this point?
Darcy Antle, Assistant CEO, through the chair, it's roughly $3 million.
Then it seems like if we have that 3 million, I'd make a motion to use 250,000 for the Grange and 250 to be split between Brook Trails and Little Lake Valley fire departments.
I would second that.
Okay, for comment, Supervisor Williams.
Yeah, I wonder if you'd be willing to amend that motion, $250,000 for the Grange as requested, the remaining PG&E funds to be split evenly between the fire agencies across the county.
So I just have a little bit of concern about keeping somewhat of what I called our disaster response revolving loan fund, because there will be times where we need money where we need it in kind of short order and we're not really sure where we're going to be reimbursed from. And we're finding that right now with the whole water issue of trucking water. So I think keeping a reserve is kind of a prudent thing to do for exactly like this. Although I certainly value upgrading our fire departments, because with what's been going on through drought and climate change, we're relying more and more on them to respond to pressing disasters. And all I can say, the 2 that I've witnessed personally this year, one in Redwood Valley and more recently close to the East Hills, it was extraordinary how good a response we had from our fire departments and the sheriff's department, and how close we were to disaster in both of them.
Glenn, I'm not against keeping some reserve for the reason you stated. I just think that if we're going to support fire, we should support it equally, or we should ask the Fire Chiefs Association or the Fire Districts Association to give us a recommendation. I don't know if we should just go, they're all worthy. They all have needs. They all participate in the large incidents. And I think we may regret if we fund, three, and there's another 18 or so that are unfunded, that may not go over so well.
Well, we're going a little bit more into your world than mine, so I'm going to have to trust your judgment, and I'm open to spending more money as appropriate. And I think you're right that we should probably study it a little bit before we make a decision sort of on the spot. And I don't.
So what if today we were to fund the Grange and then and close this item out and then come back with a more comprehensive proposal for funding fire, some of it from PG&E, some from other sources. We know fire across the board needs more funding, and it's going to bite us in that that local fire agencies don't have adequate funds to do the job today. But it strikes me as a bad process to surprise the fire community that we're taking it up today and we're going to fund sort of piecemeal in a couple areas, but not holistically.
That sounds wise. Supervisor Haschak, are you willing to amend your proposal a little bit?
Well, yeah, I mean, it certainly seems like that's a viable process. I'm just hearing that here are these fire districts that, for some reason, a miscommunication, that they didn't get their applications in on time. So I would like this to be brought back to see what we can do about funding these fire districts. But I would go ahead with sending that part of the motion over to the fire chiefs and come back with a recommendation.
So to clarify, is there agreement on asking the Mendocino County Association of Fire Districts to provide us with a proposal that captures their current needs across all of the fire districts and fire companies? And then we can look at that and decide on next steps.
Yes.
Okay, thank you.
Well, I thought that's what had already happened. Did that already happen with the Fire Chiefs Association?
I don't believe it's happened. There have been requests over the years, but we don't have an up-to-date analysis of what's needed, say, to put us on parity with other neighboring counties.
So I guess I would like, I'm willing to hear what they have to say and to bring back some proposal. And so I guess if we could amend the motion, we will fund the Grange for $250,000 and a request of the Fire Chiefs Association to bring back a plan of their needs.
I can
Chair
support.
Jordy, this is CEO Angelo. A couple comments here. One is that I'm concerned that the board does not have all the information and you're making decisions based on just partial information. And so, the PG&E dollars are it's your money to make those decisions. But I am concerned, there have been a couple comments, certainly about drought and the additional dollars that may be needed for drought, even as an interim measure. And I would also say that what you heard this morning, what you didn't hear regarding the pandemic is the amount of money that the county may have to come up with to assist with some of the areas that we need to assist with to relieve the pressure on the hospital. The hospital is in dire straits. We don't have nurses. We don't have healthcare personnel. It doesn't matter if we have beds if we don't have people to take care of the sick people there. So some of the things that we're doing are making some changes to county services so we could relieve the pressure on that hospital. That will hit our general fund. We will be back the end of the month to discuss that. Now, I'm not saying for you to use PG&E money for the pandemic. What I'm saying is I don't think the five of you have all the information. So I respectfully request that how you amend this. First of all, this was a consent calendar item. And with the consent calendar item, I would ask our chief counsel can the board just amend the consent calendar item to add additional spending of the money? I would say, my recommendation is the same as Supervisor Williams, in that you gather more information, you have staff gather more information, and we come back with that information for you to make a better informed decision. And I recognize that you want to give 250 to the Grange, that's up to you. But I think I think that, when you have a lot of money in front of you, it looks like there's a big pot of money. But if we add it up, drought, pandemic, fire, if we add it all up, it's not a lot of money. So I would just ask that the five of you think about how you want to proceed. Do you want another presentation on some of the needs that are coming up, or do you just want to make the decision? And I would ask Chief Counsel Curtis if you can amend the consent calendar item, or if that needs to wait till the next meeting. Thank you.
If I may answer that, Mr. Chair.
Go ahead.
Yes, the board does have the ability to go ahead and amend the allocation. The only thing is that this is an adoption. This came back on consent for the purposes of approving in writing what the board had done at the last meeting. So if we're going to update the writing, we may be essentially either putting this off until the next meeting when we can have an updated document for the board to adopt, or I don't know if it's possible for staff to do it by the end of the day, or the other possibility is the board could adopt this and then direct that this come back for additional action.
I think it would make sense for us to come back at the end of the day, or later today anyway, perhaps after lunch. And speaking of that, we are well past our morning break, which is supposed to be at 10:30 for clerk of board staff and others. And so if this concludes this item, it's going to come back. I'd like to take a break right here, and then we will go into the rest of the consent calendar.
that I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike or sound alike,
but we are all one community.
During this pandemic, we need to be kind to one another
And keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros. ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste. આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives. Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
So we are trying to wrap up our consent calendar, and it is 11:07. On item 4F, which is the PG settlement funds, I believe we had a motion on the table. Can we confirm that we had a motion on the table to have staff bring back later this afternoon a $250,000 allocation to the Redwood Valley Grange, and a request for the Fire District Association to bring back proposals on how they would invest additional funds. Given the millions of dollars that we've already allocated to fire issues, and the fact that we are definitely looking at the need for reserves for the county to handle what are likely to be multiple emergencies later this year, including the pandemic, likely fires, other recovery that comes with those fires. I'd like to suggest that we ask the Fire District Association to give back recommendations on how they would propose investing $1 million of additional funds, not the entire $3 million in reserves. So we would still retain some reserves. Would someone like to make a motion?
Well, do you want staff to come back later today? Is that part of the motion?
Yeah.
I move we direct staff to return later today with an amendment adding $250,000 for the Grange as proposed, and request the fire and EMS ad hoc work with the Mendocino County Association of Fire Districts to return with a plan for a fair and balanced allocation of $1 million to benefit fire services countywide.
I'll second that.
Okay, got a motion and a second. Can we have a roll call?
Chair Jurdy, before the roll call, just a clarification for the finance team. Then the only change that they are working on right now is the $250,000 to the Grange. But the other portion of that motion is a directive for the ad hoc. Is that right? So all you expect to see by the end of the day is the $250,000 added to the finance plan. Is that right?
As the maker of the motion, yes.
Okay. And then also the $250,000 that goes to the Grange, it was the Redwood Valley MAC that was asking for that money, but I'm making the assumption that the $250,000 would go to whoever owns the Grange. Is that right?
Correct.
Okay, thank you very much for the clarification.
Okay, I do see a hand raised by County Council Christian Curtis.
Thank you. And I just want to clarify for the board, these are preliminary allocations for the outside groups. There's going to have to be some additional action that's taken to actually transfer the funds, in particular to the extent that there are gift of public funds issues. There's going to have to be some sort of requirements, typically what we would have in any sort of grant document coming back for board approval. So I don't want anyone to be under the impression that this would be the final step.
Got it. Okay, all right. We have a motion. Can we have roll call?
Supervisor McGorty,
Yes.
Supervisor Hashak,
Yes.
Supervisor Mulhern,
Yes.
Supervisor Williams,
Yes.
and Chair Jordy.
Yes.
The motion carries unanimously.
Okay, thank you. That takes us to item 4E, was also pulled for the consent calendar, and that's the approval of the agreement with the City of Ukiah for the shared exercise of land use and the California Building Code Authority for the parcel number 178-210-01, and it's the property where the shooting range takes place. And Supervisor McGorty.
So I pulled this because I just want to have a discussion from county council and the planning department so that we don't create expectations that will be impossible for us to deliver on to the neighbors. And I would just like a kind of, because this is really sort of the first time the public is really getting a good look at this. I'd like a little bit about the genesis of the document, and then also how in the future things like fire on the gun club can be regulated, if at all. And I'm assuming that it can. First of all, I'd hope that common sense would prevail, that you don't shoot when it's 90 degrees at a metal target and it's 10% humidity outside. But apart from that, I just would like a discussion from our county staff about realistically what to expect.
If I may, Mr. Chair.
Yeah, go ahead.
So just to start with a very basic background, first of all, I want to make sure the board is aware. My staff alerted me that the incorrect version of the draft agreement was uploaded initially. There is an updated agreement attached with some slight modifications. That is what we're asking the board to approve today. Just generally, this is an agreement as to the administration of the building and land use laws at the Ukiah Valley Gun Club. The gun club resides on property that is in the unincorporated area of the county, but is owned by the city of Ukiah. And under California law, when the city owns property in the county's jurisdiction, the city is immune from the land use and the building laws on that property. So the county is unable to apply its laws to that location. There has been conflicting AG's opinions. So the Attorney General has opined on this issue multiple times and actually reversed course in terms of opining to the extent to which that applies to a private lessee on the property. And that's left a significant amount of confusion for some time as to exactly what laws the county can apply to the gun club while it's operating on the city property. In 2014, County Council requested an Attorney General opinion further clarifying the issue. That came out a few years ago. This JPA is modeled on the Attorney General opinion that was issued, and that the opinion is only advisory. But by agreeing to who will exercise what authority on the land, the city and the county essentially have the ability to make a final resolution of this issue. As long as we're in agreement, both jurisdictions are able to allocate the authorities between them. The draft before you was modeled after the Attorney General's opinion. It would allow the county to exercise its land use authority and other general authority on the property. It would also have the city apply its building codes and issue the building permits on the property. The reason for that is sort of twofold. One is that under the Attorney General's opinion, even when the city is completely exempt from the county laws, it still has an obligation to make sure that any structures conform to the California Building Code standards. The way that works in practice, for example, on the county properties owned within the city jurisdiction, is that we would issue the building permits to ourselves. This would essentially allow that mechanism for the city to issue the permits to the lessees for buildings the city will be owning and will ultimately presumably own after the conclusion of any lease. The other part of that is that while the city's code and the county's code are built, they're both established based on model codes adopted by the state of California. There are some slight variations that can be authorized. I don't know that we've identified any that would be particularly relevant here. However, the general trend has been for the county to want slightly laxer standards than the state of California imposes. And in the past, this board has asked us to look at areas that it can sort of relax standards in the building codes. And because of that, the city, who is ultimately the property owner, may be sort of more appropriately served by applying its own building codes to the structures that it will be owning. There had been, I think, a question raised previously by Supervisor Williams regarding the comments from the plaintiff for the Vichy Springs Resort. So counsel for the resort has sent in a letter objecting to this agreement on a few grounds. I would just note, I do not concur with the statement that the city and county are powerless to enter into the agreement. Plaintiffs seem to be arguing that the exercise of the building permitting function is not a common bit tower between the city and counties. The code that they're citing is pretty explicit that the power does not have to be exercised within the same geographical area. That as long as both jurisdictions have the authority, it's the proper subject for a joint exercise of powers agreement. And in this case, both the city and the county pretty clearly have the ability to implement building codes and to issue building permits. So I'm really not certain what their rationale was in the letter. There wasn't a lot of explanation, but I wouldn't agree with the opinion expressed therein. And then, obviously there were some other points raised about whether or not, to have a termination clause. That's generally something that we build into these sorts of agreements to allow one or either party to be able to withdraw, when circumstances change if deemed appropriate. I don't see anything in their letter indicating there's any sort of legal obligation to do so. I'm not aware of anything that would be one. That's really just sort of a policy call. And that was what was agreed, at least in the discussions between staff at both the city and county level. So in terms of Supervisor McGordy's question as to what this will mean going forward, this will mean that it's clear that the county will be able to exercise, once it's executed by both the city and the county, this will be clear that once it's executed, that the county will be able to apply its land use laws to the gun club. Now that may mean that for certain actions, they're going to have to apply for permits or otherwise comply with our zoning regulations. I will say sort of two things. I've seen some of the comments in there from the public about shutting down or making massive changes to the gun club. It is both a use that is allowed in that district. A shooting range is allowed in rangeland, and additionally, it is also something that's grandfathered in. So there for certain changes, they're likely to have to apply for permits. On the other hand, I wouldn't want to give the impression that this just immediately means that the gun club would be shutting down. Well, they're going to have to comply with existing laws. I know some of the concerns that have been raised might not be things that are sort of directly relevant to current ordinances. We do have nuisance laws relating to fires. I really don't know what the circumstances were regarding the most recent fire. The county would have some ability to sort of look into that. On the other hand, it's also possible that sometimes fires do happen when people are in full compliance with all applicable laws. If there isn't some sort of unreasonable risk being presented there, that might be something that if the county wanted to impose new requirements, might require some sort of legislative act that would be of general applicability countywide, rather than something that might be addressed under the existing laws. So I hope that answers your questions. If not, I'm happy to answer any others you may have.
I see no other questions at this time. Do you see David Rappaport from the city of Ukiah's? I don't know if he has anything he wants to add on this agenda item. Okay, so what would the board like to do with this consent calendar item?
So for me, it was just a matter of clarification so that everyone understood what this action means for now, because there was quite a lot of concern coming from adjacent neighborhood, and as far as the fires go, I'm not sure who has authority for that, but certainly it's something that needs to be addressed as a public safety matter. And I don't know if our own codes, nuisance codes cover that or what, but the fact that we've had 2 fires in the neighborhood within the last year concerns me as someone who is charged with assisting public safety, and I wondered if under your understanding as a person with fire expertise, typically how those incidents are investigated and how it might be responded to from the appropriate fire authorities.
Well, I think it would be responded to by the nearest resources. And if it's state responsibility area, I would expect CAL FIRE to follow up with a report, which should be publicly available. But I guess I see the fire issue is very real, the concern about potential ignition sources during an unprecedented drought and high heat. But I don't know that that's related to the agenda item at hand. So maybe Supervisor McGordy, would you like us to support this item?
Yes, I would. Thank you.
Okay, we did have some public comment on this item. I think we already heard all the public comment on this item, but I'm just looking to the clerk of the board. Otherwise, I guess we're ready for a motion.
There is no further public comment on this item.
I move approval of the consent calendar.
I second that.
Okay, so for clarification, it's the entire consent calendar with item 4E coming back this afternoon.
Right.
I'm sorry, Mr. Chair, did you say 4E or 4F?
I'm sorry, you're correct. With 4F coming back later this afternoon. Okay, can we have a roll call?
Supervisor Mulhern,
Yes.
Supervisor Hashak,
Yes.
Chair Jurdy,
Yes.
Supervisor Williams,
Yes.
and Supervisor McGordy.
Yes.
Okay, that takes us to item 5A, which is discussion possible action, including appointment of an ad hoc committee regarding responses to the 21-22 grand jury report.
Thank you, Mr. Chair. At this point, there are 3 grand jury reports that the Board of Supervisors needs to respond to. One relating to homelessness, one related to housing, and one related to county IT. I brought this item forward because our typical process is for the board to go ahead and appoint an ad hoc committee to go ahead and draft responses and to work with county council on getting a document together. I just wanted to give the board the opportunity to create any appropriate ad hoc. I have no particular recommendation as to composition or whether you do 1 ad hoc or 3 ad hocs.
Maybe for consistency's sake, it's probably best to have 1 ad hoc for all the items. Supervisor McGordy?
I was going to think just the opposite, just for workload sake. It seems like splitting this up might be a little better so that we don't really overload anybody with 3 completely different subjects that are substantial in their weight.
Supervisor Mulhern?
Thank you, Chair. I was actually going to recommend that the IT ad hoc take the IT grand jury report. It makes the most sense to me, the most knowledgeable about what's happening and can probably answer the questions much more efficiently than somebody else jumping in on this.
I could support that.
That makes sense.
Yeah, I would agree to that as well.
Okay, If we're going to have multiple ad hocs, who wants to volunteer for the other two? Supervisor Hashak.
Well, I think that there should be one ad hoc that deal with the homelessness and the housing situation. So I would volunteer for it.
Thank you. Supervisor Moore.
I would volunteer for those two as well.
Thank you both.
Right. So
Thank you.
do we have any public comment on this agenda?
No, we do not.
Okay. Well, then maybe we could just record this as a directive from the board to appoint an ad hoc committee, well, to refer the grand jury report on IT to the IT ad hoc committee, and to create a committee, ad hoc committee of supervisors Hashak and Mulhern to draft a response on the homeless and housing grand jury reports. Okay, if we could just record those as directives, we could then move on to item 5B on the agenda. And item 5B is a notice of public hearing, a discussion possible action, including adoption of resolution authorizing an application, adopting the ELHA, Permanent Local Housing Allocation Plan, for the Permanent Local Housing Allocation Program in the amount of $2,099,000. And so for this, I look in the clerk, has proper notice been established for today's hearing?
Yes, proper notice has been established.
Okay, well then at 11:27, we're going to open the public hearing. And have you noted all correspondence received on this item?
Yes, all correspondence received has been uploaded to the item, and there are no requests for telecomment.
Thank you. Okay, well then we're on to the staff summary and presentation.
Good morning, Mr. Chair, members of the board, Steve Dunnicliff, Deputy CEO. And for this item, background on PLHA, it's Permanent Local Housing Allocation. It's a funding mechanism that was created in 2017 by the Building Homes and Jobs Act, or SB2, which established a $75 recording fee on real estate documents. Beginning in 2019, the collected fees became available to fund PLHA formula and competitive allocations each year. PLHA creates a permanent source of funding to all local governments in California, which will help implement plans to increase affordable housing. Generally, this funding is intended to help increase the supply of housing for households at or below 60% of area median income, increase assistance to affordable owner-occupied workforce housing, assist persons experiencing or at risk of homelessness, facilitate housing affordability, particularly for lower and moderate income households, promote projects and programs to meet the local government's unmet share of regional housing needs, and ensure geographic equity in the distribution of funds. In order to access formula PLHA funds, the county must develop a plan to allocate funding for the entire 5-year planning period and provide the public the opportunity to comment on that plan through a public hearing. The PLHA funds discussed in this public hearing represent Mendocino County's 5-year non-competitive formula allocation of $2,099,753 for fiscal years 2019 to 2023. The county's home key grant application for Live Oak Apartments specifically included all of the 2019 and 2020 PLHA applications for facility renovation costs, which were not covered by that grant award. Funding from the 21, 22, and 23 allocations would be used under this plan to fund the 2.0 FTE on-site case managers and the half FTE case manager supervisor at Live Oak, along with providing an operating subsidy for that facility. On-site case managers are critical to the success of this housing model. The managers work with residents to support their efforts to achieve personal goals, helping residents avoid a return to homelessness and prepare to secure more traditional housing options. The facility operating subsidy will help defray public costs and bridge any operational funding shortfalls. So that concludes my prepared comments for your board on this item.
Okay, all right. Well, do we have any questions by board members of the proposal? Supervisor Mulhern.
Thank you. I don't have questions, but I hope the board will support this proposal. This project is one of a kind and it has, I think, given the community an opportunity to try something different when we're talking about homelessness. And I think that it is very important that the folks that are in this project do have support so that they can meet their goals and hopefully as many of them as possible can move on to other housing situations so that we can bring more people into the program. I hope that there will be a bit of a revolving door as people step up into other housing.
Supervisor Hashak.
Thank you, Chair Jurdy. Yeah, I totally agree with that. And I think when I toured the Live Oak Apartments, that one of the crucial points was that there was a need for staffing there at all times. And so I really appreciate that this proposal funds that, because I think that's critical for the success of the program and success of the neighborhood too.
Thank you. Supervisor McGorty.
I would just like Megan Van Sant to weigh in and just let us know where the project is right now and what's happening.
Hi, is that an invitation for me to speak really briefly?
Yes, it is. Absolutely.
Okay.
I always love hearing from you.
Thank you. The project's going really well. I was reflecting as Supervisor Mulhern was just speaking about the element of this project that helps families stabilize, get back on their feet, and then move to a more appropriate housing is definitely coming true. Another family just moved out yesterday to permanent housing. This is a family that's been their 6-year-old has not lived in a stable environment his whole life. So it's really exciting to see that process that we thought was going to work actually in practice. And I agree the case management staff on site is critical to the success of this project. And I'm not sure if there's anything else to say specifically about this project, but so far so good. Again, I will say there are issues every day that our staff handles. So their presence on site is critical, as Supervisor Haschek stated, to both the health and well-being of the community that we're serving and the community at large.
Supervisor McGorty.
So how are you getting along with the neighbors?
Very, very well. We have not had any negative interactions with the neighbors at all, except for one source of feedback early on in the project where a neighbor asked us to alert the residents to be more careful with their dog droppings, and we got right on that, made sure everyone had little bags, and we haven't heard about it since. So our communication with neighbors has been great, better than I had anticipated, honestly.
So Mika, can you just give us a little background on these funds? Are these the funds that come from the real estate transfer tax that was put in sort of as a substitute for redevelopment, or is this some other funding source?
I'm going to let Steve Dunicliffe respond to that. I don't think it's a substitute for redevelopment, but I'm not the right person to ask for that.
Just to weigh in, these funds do come from a $75 fee associated with recording documents. And so again, it's nowhere near the amount of funding that was ever available through redevelopment, but it's a new dedicated source of housing revenues.
Okay, yeah, I wasn't trying to say it was equal to, but it was put in place after redevelopment was eliminated. Okay, great, thanks. Looking to the clerk, do we have any public comment on this item?
No, we do not.
Okay. If we have no other comments from staff, we will close the public hearing and at 11:35 and entertain a motion for the board.
Move the recommended action.
Second.
Okay, we have roll call.
Mulhern,
Yes.
Supervisor McGorty,
Yes.
Chair Jurdy,
Yes.
Supervisor Williams,
Yes.
and Supervisor Hashak.
Yes.
The motion carries unanimously.
Okay, thank you. So now we're on to item 6A, which is discussion and possible action, including an update regarding emergency early warning alerts and options associated with the provision of emergency services operations in Mendocino County, including potential collaborations with other affiliated agencies. And this is being brought forward by Supervisors Mulhern and Williams.
Thank you, Chair. Do you mind if I start?
Go ahead.
Yeah, so I just wanted to, Supervisor Williams and I wanted to bring this to the board for discussion so that we could move forward with trying to figure out where some opportunities are to improve the alert and warning and OES systems in Mendocino County. As you know, we're already into fire season, and it's very important that our community understands what their evacuation orders are, where fires are located, so that they can be prepared. Additionally, we are undergoing a strategic plan. And as we discuss operations of the county moving forward with CEO Angelo's retirement, I think it's important that we have options as to how OES should continue to be carried out. I think there's a lot of choices, and so the board, at some point in the near future, should be making decisions about that. So that item was really just to see if the board agreed that we should work on this and bring back some recommendations.
Supervisor McGordy.
Well, I think that's a really good idea, because as we're trying to work through some of these less conventional sort of emergencies, like a drought emergency doesn't fit into, a one massive all hands on deck kind of emergency. And we're struggling a little bit kind of working through coming up with a response team. And I think that it would be good to clarify some of the roles that people have and some of the interactions with different departments. So I support this.
Supervisor Hashak.
Thank you, Chair Jurdy. I guess my question would be, has the OES, Office of Emergency Services, and the Sheriff's Office been consulted on this? And, what part are they playing in this discussion?
I can answer that one, John. Our OES director is actually our CEO, and she has been part of the conversations. The idea here is CAL FIRE is one of the premier firefighting agencies across the world. They have a lot to be proud of. They provide services in other counties beyond what they're providing today in Mendocino County. We do have the option of contracting. They may be able to play a life-saving role with those additional services at a cost lower than we can implement same services. So the idea here is not to set anything in motion. It's just fact finding. Bring back the options. What would it cost? What would they be able to provide? And we can talk about whether it would integrate with our existing services.
Okay. Supervisor Mulhern, you have your hand raised.
Yes, I just wanted to add that I've personally spoken with Brent Blazer and Sheriff Kendall about this agenda item, and they will be included in the conversations as we move forward. If that was I think the question Supervisor Hashak was getting at.
Right. Well, thank you.
Okay. Do we have any public comment on this agenda item?
There is no public comment on this item.
Would someone like to make a motion?
Move the recommended action.
I would second it.
Can we have roll call?
Supervisor Mulhern,
Yes.
Supervisor Hashak,
Yes.
Supervisor McGorty,
Yes.
Supervisor Williams,
Yes.
and Chair Jordy.
Yes.
The motion carries unanimously.
All right, that takes us to item 5D, which is discussion possible action, including adoption of a resolution establishing and setting the time and place for conducting business of a cannabis standing committee. County Council is bringing this forward at the request of the board.
Thank you, Mr. Chair. There had been some discussion of this earlier during the minutes. This is the item related to the creation of a standing committee that the board had sort of briefly discussed at the last meeting. I understand Supervisor Mulhern and Supervisor Hashak might each have their own ideas on sort of what might be the best pathway forward on this. I prepared a resolution just because if the board is going to take action and decide that it wants to create a standing committee, I wanted to have the document ready for you so that you could take any action you deemed appropriate. And with that, I think it may be appropriate for the supervisors to take over the discussion.
Thank you. Supervisor Mulhern.
Thank you, Mr. Chair. Yep, we are about to face some very challenging conversations as a board about how we move the cannabis industry forward. And I believe that this needs to be done by the full board at a public meeting so that it's open and transparent. And in regards to the details of the cannabis program, I do believe that we have a competent leader in Kristen Nevedal, and we need to step back and let her do her job. And I don't believe that we need a specific cannabis ad hoc at this time.
Supervisor Hashak.
Well, when we gave direction to the board or to the county council last time, is that we gave direction to, come up with the creation document for this standing committee. I think that the board at that time recognized that there's lots of work to be done in cannabis, and there's always issues coming forward. It will save time if we can have this process happen in a standing committee. It will save time for the board overall. And I think that this is the right direction to go. And I think the composition of the cannabis or standing committee is just the issue that we're supposed to be dealing with today. And I think that if we don't go forward with it, it will send a message to both the cannabis community and the community at large that, we're going to be spending more time in board meetings and that this is not a significant thing. So I think that we need to just go forward and pick the people who are going to be on it.
Supervisor Williams, then Supervisor McGorty.
Yeah, I think we've hit a point of diminishing returns, maybe even negative returns. We need to let Kristen do her job. I think Mo is right. Adding more direction, thrashing staff around, do this, no, do that. It's not going to help get through the queue. We have staff working through the queue of permits, trying to help people get to their state license. There may be a time for this. I don't think that time is now. And I think the public also demands that we take on some of the other issues. We spend a disproportionate amount of time with cannabis. It's time to take up some of the other pressing issues.
Supervisor McGorty.
It kind of goes back to my infamous 10-point memo about how we should just take some time to catch up, to take a breath, to get people through the permitting process, and also try to get our enforcement response together, which is being worked on by planning or building code enforcement and sheriff's department. My concern with this is that how this would work is that we wouldn't necessarily be saving time. There, a lot of things would be referred to this. There would be a lot of public hearing at it. Then it would come to us for decisions on things, and there'd be a lot of public hearing on it. So I'm kind of feeling at the moment, let's kind of take a break and not overload our cannabis department with yet more workload. I think we can revisit this in a quarter, because I kind of agree with Supervisor Hashak that at some point we got to start having public discussions. But for right now, I think taking a pause on this would be a really good idea. We have spent a disproportionate amount of time on cannabis since I've come on board. And the supervisors of longer tenure, probably even more so. And I kind of feel like there are other things that we need to concern ourselves with. So I personally don't see this as necessary at the moment.
Okay, Supervisor Hashak.
Well, I guess the issue is, can the issues that need to be dealt with as far as cannabis, and we have them by the handfuls. We got lots of issues that need to be dealt with. And is it better to have a standing committee, or are we going to be spending more time in full board meeting, dealing with them? And I just can't see these issues not being dealt with. And if we can deal with them in a standing committee where we can really look at what the issues are and work through them, and then before they get brought back to the board, it will be a time-saving process for us. So I just don't see these issues. We can say, oh, we aren't going to do a standing committee, but the issues are not going to go away.
Okay, Supervisor Williams.
Supervisor Haschak, could you enumerate the issues, specifically what is pending?
Well, okay, for example, just the other day, when we had the fee hearings, we had several issues that were referred to the ad hoc committee. We didn't deal with them as an ad hoc, but those need to be dealt with as far as a tax appeal, as far as fees go. And then there's the staffing issues. There's all these issues that keep coming up with the cannabis program. I think that we need to be looking at streamlining still. We need to be looking at a program that is sustainable, and what we can do with sustainable bio-intensive gardening, and some of those kind of things that we can deal with in the standing committee. Supervisor Williams, that these issues just keep coming up and coming up.
I do, and one way to stop them from coming up is to not creating a standing committee today and decide we've got to take on some other priorities. And that simply asking our cannabis program manager to change the program and have another fee hearing, and I don't know what the other items were. It's just, I think it's derailing her from getting her primary work completed, which is get everybody in the queue processed, either booted out for non-compliance or ready for state licensing. And I don't want to hold another fee hearing to talk about reducing a fee a few bucks if it means we're impeding the ability to process applications. This is what I think Glenn is getting at. I think it's time to step back and let the system process and try to get caught up before we add more workload. So if there are specific, the reason I asked for the list, if there are specific items that are really high priority that are blocking licensing, any one of us can bring those forward, or ideally the program cannabis manager would bring it forward. But I don't know if we want to sort of crowdsource ideas. What more could we discuss about cannabis? We've discussed it and discussed it and discussed it. And the idea of putting cannabis and streamline and saving time in the same sentence just hasn't panned out.
So Supervisor Hashak, I agree in concept that a standing committee or ad hoc committee, either one, would be the way to vet issues and bring forward recommendations. But the history of the ad hoc committees that we've had on cannabis have not shown that the issues have been resolved at the committee level with a unified recommendation from those committee members and staff that were successful. So at this point, I would like us to do what we each individually could do to take a break from this issue, to not encourage members of the public to continually relitigate issues that have been litigated 5 or 10 times already, and let this program just resolve itself, resolve the applications. Some people are going to get booted out of the program because they don't comply, and sorry, but that's just the facts. And others are going to succeed, with a little bit of encouragement and help. And but anyway, I just feel like we've been relitigating the same issues over and over and over again on cannabis, and I think we need to let the program play itself out. Supervisor McCourty.
I have a question for county council too, and this is the ability of us to have conversations among ourselves if we don't have a standing committee or an ad hoc. How does that affect?
I'm sorry, I got a little bit of an echo there. I think that I understood the question to be essentially, if there isn't a standing committee or if there isn't an ad hoc committee, how much are the board members able to discuss the issue outside of the context of a notice board meeting? And the answer to that would be the same as for every other item. Essentially, two of you could discuss an item without creating a Brown Act violation, but the moment either of those two talks to a third, then that's prohibited. So essentially, anytime this would be coming up, if you want a discussion among 3 or more members, then it needs to be in front of the full board at a noticed meeting. I do like to say that ad hoc committees, in part, are a way to avoid a Brown Act violation. They're a way to essentially tell the rest of the board, don't talk to those two people because they will be talking to each other about this subject. Although I've noted in the past, ad hoc committees are supposed to be single subject and short duration. Something kind of as nebulous as cannabis, I think when we initially defined the cannabis ad hoc committee, it was considerably narrower in that it was specific to interfacing with CDFA on specific issues there. And I would just caution the board generally about treating ad hoc committees as though they have general subject matter jurisdiction. You want to define the scope of it as being pretty narrow and pretty limited. Otherwise, the Brown Act requires you to have a standing committee, or rather requires that the ad hoc committee become a standing committee if it's got an ongoing subject matter jurisdiction, at which point all of those meetings have to be noticed in public, and those two are not able to speak to each other about that subject matter outside of a notice meeting at all. Did that answer your question?
I think so. So within the broad subject of cannabis, so if we, how specific is that? Is cannabis like you can't talk to more than 2 people, or is it if you're thinking about statewide regulations specifically versus cultivation in a particular part of the county? How does that work?
So I don't know that I can draw an exact line as to when exactly a topic bleeds into another. So, for example, I wouldn't say water as an abstract topic would be something that if you've talked to one supervisor about a water proposal, say in a particular watershed, or for just curtailment, that you couldn't discuss something somewhere else with a different supervisor. I would, however, suggest being pretty careful about that all around. One of the things that I would say is a potential concern is that if the 2 supervisors who are talking don't understand the scope of what they're talking about to be the same, then either one of them could potentially end up creating a Brown Act violation by speaking to someone else. So it really helps to try and give that some clarity as to just how limited a topic or proposal is that you are discussing with an individual supervisor. And just generally, I would say, if you're uncertain, it's best to err on the side of caution.
Okay, thank you.
So I'm not seeing support for, at this time, creating a standing committee on cannabis. We do have a proposal here that could be used at a future meeting if circumstances change. Would someone like to make a motion, or do we want to just drop this issue for the time being?
Need Ms. Public comment, Mr. Chair.
Okay, I'm sorry. Did we have public comment on this agenda item?
Yes, we have Michael Katz on the line.
Hello, Supervisors. This is Michael Katz, Executive Director of the Mendocino Cannabis Alliance. I must say I'm very disappointed to hear the direction that this conversation has gone. It is clear from the cannabis community and from the public at large that the items related to cannabis in this county have not been resolved. The hiring of one cannabis program manager does not indicate that the entirety of issues that need to be addressed are still being addressed. The truth is, we have submitted a memo first 2 weeks ago and again today that lists no less than 11 specific items that a standing committee could immediately attend to, including attending to or our ordinance 10A17 and making sure that it is in a position for folks to go forward. The truth is that there is not a situation that we should be looking at where we say that we should let the program play itself out, as Chair Jurdy just mentioned, unfortunately, because so far as everyone has identified, that has not worked for the county and has not worked for the cannabis program. To put off creating a standing committee now would be to put off trying to work on solutions that might not be able to come to fruition for another several months. And those conversations need to be started now with input from members of the community. I find it very interesting that many of the comments that were raised by members of the board just now were indicating a lack of desire to incorporate expert opinions and suggestions from the community. And to be honest, that is how we got to where we are today, with the lack of input and the thought that these things will just take care of themselves. The experts in this community have given their word and their efforts to support the program and continue to do so. If there is not a mechanism that enables real interaction between the board and the cannabis community, we are in danger of continuing this trend of not succeeding as a community, as a county. And I urge you to reconsider and to enable the formation of a standing committee so that we can actually address these issues in a pragmatic way that does not draw away from the various needs of the Board of Supervisors in other areas and allows complete proposals with stakeholder input from the entire community to come to the board instead of having a reactive response, which has happened to this point. So I encourage you wholeheartedly, do not leave your community in the dust in this way. Please create a standing committee and enable us to work together to solve the problems that we have not had the opportunity to solve yet.
That concludes public comment for this item.
Okay, how would the board like to act on this item? Supervisor McCordy. You're muted.
We can table it for now, and I think revisit it in the future. We also want to see what happens with the referendum. I think we know it's going to happen, but let's wait until it's official and revisit it at that time. You know, I'm hoping and dreaming of something else, which is that the state would actually give us a model ordinance that we can follow, because I kind of feel like we've spent a huge amount of time coming up with 2218 to no avail. We don't know that for sure, but that's how it's looking. And I think that there's some frustration on the part of the majority of the board members that we want to spend our time productively. And I think that that's why we're kind of taking the position that we are at the moment.
Okay.
Excuse me,
Supervisor.
Chair.
Go ahead, Alice.
We do have one more person on the line. It was submitted a little bit late, but we'd like to let them speak if you'd like.
Yeah, go ahead.
Okay, it actually appears that Monique Ramirez is no longer on the line.
Okay, all right. Supervisor Hashak, then Supervisor Williams.
Thank you, Chair Jurdy. I'd just like to say that what Michael Katz was talking about was community involvement in decision-making. And, you know, if we don't have a standing committee and we don't have a process for working some of these issues out outside of the regular board meetings, these issues won't get dealt with, you know, and to think that we don't have a lot of decisions to be made and we can't be helped by a standing committee that can really look at these issues in depth and try to come up with solutions for them. You know, Supervisor Williams and I worked together on a lot of issues, and we did bring a lot of issues forward that helped out the program, but we certainly haven't solved all the problems. And, you know, we have this referendum before us, we have the equity grant, we have this $18 million of grants, and how do we use those? What's the best way? You know, there's so many decisions that need to be made. And if we can do them outside of the board meeting in a standing committee with community input, I think we'll all be better served. Because right now, if we don't, you know, we're wasting the time. And if the deadline for getting the annual permit is July 1st of 2022, then we don't have time to waste. And so we need to be pushing this forward. And if we wait and we don't form a standing committee, then we're just, we're in essence wasting time, losing time on this issue that's crucial to our county.
Supervisor Williams.
I actually don't believe that our policy making or lack of is blocking licensing. We should ask our cannabis program manager to tell us how many complete applications she has today versus how many incomplete. I don't think there's any decision making on our part that will get those completed applications submitted. Is it possible to ask Kristen to comment? How many completed, how many non-completed?
It's in the CEO report.
We're letting Kristen have it all into the meeting right now. It just takes a moment.
Hello, Kristen Neville here, Cannabis Program Manager. Good morning still, or officially afternoon, board members and Chair Jurdy. I did update the chart that is in the CEO report since we put the information into the CEO report. So I'll give you some updated numbers. As of today, we have had 83 completed applications submitted to the portal. We have reviewed all 83 of those submitted applications, and 22 of them have been deemed complete. And we have sent status notifications to all 83 applicants that have come through the portal so far. We do have some concerns that those numbers are low, both in submittal and in what has been deemed complete. The numbers did jump pretty significantly when we did the secondary review of the 32 that we received on the 14th or the 13th. You know, we have 9 more weeks after this week, so about 9.5 weeks left in the portal. I did talk to client first yesterday, and we did get all of the contacts out of the Trackit system. So we'll be sending a mass mailer in the next couple of days to all applicants, reminding them about the portal. And those are the numbers that we have to date.
Kristen, are there any issues that a hypothetical standing committee could take up to bring back to the board to give you direction that would boost licensing? Are applicants blocked in a way that we could resolve?
I mean, I think the challenges that we're seeing with folks coming through the portal is it's pretty simple, right? Checking all the boxes, making sure that they don't give us expired paperwork, expired IDs, expired Cal Cannabis permits. So I don't know that a standing committee could resolve that for the applicants. want to just acknowledge that a couple of the items that are on the MCA memo, such as SSHR progress, we're going through and working that data into custom screens. So we'll be able to report out on the data around how many SSHRs or questionnaires have come in, how many continuous expansion affidavits we've received, and what the status is of any of the referrals that have gone out. So we are hearing those concerns loud and clear. We'll be building out the same sort of data capture and export capabilities for Appendix G. I think that'll help the community. And we're more than happy to report back to the board around permitting statistics on a regular basis. So we're already moving forward with a lot of those requests currently.
So what I hear is no amount of direction from this board would change the outcome on permitting and licensing for 10A17.
If that's a question, you know, we are doing our best to work with what is in front of us. And so I don't think that, you know, further direction would help us evaluate the applications that are coming in. I don't know that it would help the applicants understand what needs to be submitted. We have a pretty thorough checklist. Yeah, I'm not exactly sure how to answer that in a meaningful way.
That was good. Thank you.
All right. Well, so I've heard 4 of the 5 supervisors saying that this is not the time for this item to come back to the board. Would someone like to make a motion to direct that this the issue of a standing committee will not be brought back to the board until there are at least 2 supervisors who want to sponsor such an item? Supervisor McCarty?
Yeah, I would so move, and also note that standing committee probably is a good idea, but we would prefer to wait until such time as there's a little clarity on where we stand with our referendum. And maybe I'm making this too complicated, but essentially, when there's 2 supervisors ready to bring it back, that's when we'll do it.
Mr. Chair, I would second, but I'd like to make an additional comment.
Okay, go ahead.
Yeah, I just wanted to clarify. I don't believe that this is reducing the amount of work that the board needs to do on cannabis. We have very important decisions that are going to come before us in the next month or 2 regarding 10A17 being reopened and what to do with 2218. And I just firmly believe that those conversations need to happen with the full board in a public setting, and the community needs to have their voice heard by everybody. And as far as standing committees or ad hocs, sometimes that doesn't happen. It's only a few people at the table, and we really need a very large table if we're going to get through this cannabis conversation.
All right, thank you for those comments. Okay, we have a motion on the table. Can we have roll call?
Atlas Pearson, Deputy Clerk of the Board. I just want to clarify, the motion I have captured is that the issue of creating a cannabis standing committee not be brought back to the Board of Supervisors until such a time as there are 2 supervisors willing to sponsor the item.
Yes.
Supervisor Hashak?
No.
Chair Jurdy?
Yes.
Supervisor Williams?
Yes.
Supervisor McGorty?
Yes.
And Supervisor Mulhern?
Yes.
The motion carries with Supervisor Hashak dissenting.
Okay, so we have several closed session items. And I'll look to County Council to confirm which items we have for today.
Thank you, Mr. Chair. I would note that item 9C is withdrawn by staff. Otherwise, my office does need to proceed with items 9E and 9E, or sorry, 9E and 9F. And I don't want to speak for the executive office or HR. I believe they have items on as well.
Okay. All right.
Jurdy, we do have an item under 9A with labor today.
Okay. All right. Well, then we will go into closed session as noted.
family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone, especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible to save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic, we need to be kind to one another
And keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
ये bet में आया.
我们能够做到.
Podemos hacerlo por todos nosotros.
Idi manandarki sadyam.
A gente pode fazer isso. Yon robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste. આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives. Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible,
to save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros. ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants,
which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone, especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I. 我们能够做到.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone, especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community. Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me, yeah.
我们能够做到.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love. I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
我们能够做到.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
નમસ્તે, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community,
not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
Back to where we were last year.
Worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
We need to be kind to one another.
And keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me, yeah.
我们能够做到. Podemos hacerlo por todos nosotros.
Idi manandarki sadyam.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I, yeah.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
નમસ્તે, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
નમસ્તે, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me, yeah.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
નમસ્તે, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me, yeah.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community,
not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
નમસ્તે, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
We need to be kind to one another.
And keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
નમસ્તે, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo.
A, 9D, 9E, and 9F direction was given to staff. 9B and 9C were not discussed during closed session. So that takes us to item 5F, which is discussion of possible action, including interviews with applicants and possible appointments to the Mendocino County Community-Based Advisory Redistricting Commission. Each applicant will be brought in one at a time and given a total of 5 minutes to respond to questions. Looking to the Executive Office and County Council to just introduce the item.
Good afternoon, Chair, members of the board, CEO Angelo, and County Council Curtis. This is Sherry Johnson, Deputy CEO. On July 19th, 2021, the board voted to establish a 5-member community-based advisory redistricting commission and directed staff to solicit applications from the public. We received 8 applications, and we've had 2 withdrawals since we've received the applications. So Mr. Chavez and Ms. Shepherd have withdrawn. So we have 6 community member applicants currently in the waiting room. So I just want to go briefly over the process. So Chair Dirty will invite the community member applicants in one at a time. Chair Dirty will ask the applicants to briefly describe their interest in serving on the committee and then open to board members to ask any additional questions they may have. When finished interviewing all applicants, each board member will make their recommendation and then the board votes on recommendations. And I wanted to let you know that Assistant County Counsel Charlotte Scott, Lee Farr, GIS coordinator, and I are available for questions or assistance during this process. So if you have any questions for me right now, or I'll just turn it over to Chair Dirty.
Okay. Supervisor Williams.
I understand the population in our county over 10 years changed by about, is it 4,000?
I believe that's correct, yes.
Do we have any sense of whether that's roughly equally distributed between the districts, that increase?
Through the chair, I would like to ask if Lee Farr is available. Maybe Lee could answer that.
I guess the overarching question is, has anything changed, or is this just the margin of error of a census?
I believe, Charlotte, if you have any information on that too, but what I understand from the information that there was a slight increase in population in Ukiah, Willett, and Point Arena.
I see a hand raised from Charlotte Scott, Assistant County Counsel.
Thank you, Chair Jardy and Ms. Johnson. Just to briefly respond, I think there is a 5 to 10%, I guess you could call it a margin of error. However, the process of redistricting still requires that we go through this public process and work with the public in assessing the district's comparing the population changes to our current districts and reaching out to get public feedback on communities of interest. So that process, we need to move forward with that process. And I think our hope is that the board can establish the members of the commission today. And then when we get the final numbers from the federal government and state, which we anticipate, we hope are going to arrive sooner than we originally projected. But as soon as we get that information, we can start the formal mapping process.
Okay, thanks, Charlotte. So if I understand correctly from the clerk, Mr. Chavez and Ms. Shepard have withdrawn, and then calling these applicants in alphabetical order. First would be Paula Cohen. So if Paula Cohen could be brought into the meeting and just introduce herself within 5 minutes and be available for questions, that'd be great.
This is Atlas Pearson, Deputy Clerk of the Board. Ms. Cohen is not currently on the line. Would you like us to go to the second person?
Sure.
So this will be Kyle Farmer.
Okay, I'm unmuted. Anybody hear me?
Yes, we can.
Good. Well, thanks for having me today.
Mr. Farmer, would you like to sort of introduce yourself and just make yourself available for questions?
Yeah, so my name is Kyle Farmer. I'm a cattle rancher out in Potter Valley. I've been looking for a way to get involved more civically, and was excited to hear that there was an opportunity that was sort of a discrete time limit rather than something that would be weekly in perpetuity, and to be doing, really dig deep into 5 real meetings seems like a great way to learn more about the county, and especially learn more about the districts further away from where I am, and figure out how we make sure that we don't make huge changes someday, but can make sort of predictive piecemeal changes little by little. I don't know much about redistricting, as I don't think anybody really does. I've been able to find a little bit of information about the 2011 process and some of the ideas that came out of that. Seems like there was a lot of good progress there. And that's kind of my approach to most issues, is to start understanding the history and then understanding the present. But yeah, I'm open to any questions.
Sure. Would you like to just say a little more about yourself, about your background?
So my longer term background, I studied international relations and worked for the World Health Organization, the Inter-American Development Bank, and several small NGOs in DC before deciding to become a farmer. Ended up growing vegetables and then joining my wife's ranch here in Potter Valley, and have continued to stay involved with my international contacts in terms of good governance questions, but have mostly been focused on taking care of the ranch here, and but continuing to stay involved at the county level. I'm on the board of directors with the Farm Bureau. I'm technically involved with the Inland Mendocino Land Trust, but haven't had the time for that. I'm good friends with Glenn. I've learned a lot from Glenn, and I'm really interested in how the county can continue to govern itself well.
Thank you. Supervisor Hashak has a question, comment.
Thank you, Chair Jardy.
Yeah, Kyle, this is a question I'm going to ask of everyone is, do you have a particular change that you would like to see as far as the configuration of the county and the supervisorial districts?
You know, it'd be hard to say without knowing what the new numbers look like. And I think it would be a mistake to come in with really strong visions for what that could look like. In the little bit of research that I've done, there was an option called E2 back in 2011 that you know, I think that if you could interview a Martian and have them look at the map, I think that they would probably come up with something a little different than what we have now. But there's clearly also an important, it's important not to change anything too dramatically. But I do think that that E2 option, that specifically from a District 1 perspective, would bring the Russian River watershed into a single district and would kind of look at things a little more, bioregionally, would be interesting. I also thought that it was a good point they made in their discussions about that E2 option, that by putting Leggett and Piercy into the 3rd district, it creates 3 districts that make contact with the coast. And from their perspective, their research at the time, and I don't know if we would come to similar conclusions or if I would come to similar conclusions, that might kind of alleviate some of the strange situations you have just because of such rugged topography, where there is at least a perceived division between the coast and inland. I thought that was an interesting point they made as well. But really it would come down to, back then it was, the highest variance was in District 5 and it was 8%, right? So you had to get it back below 3. And I'm also just really curious, the longer term question of, if you do see continued growth in the urban areas, you could perceive a longer term issue, a 20-year issue, where the only way to continue the redistricting process as it is would be to kind of try to give Ukiah suburbs to each other district. And that wouldn't make any sense. So I'm curious about how we could include some of the longer demographic trends to try to come up with something, some scenarios to make sure that you don't have that sort of irrational boundary lines at some point, just to kind of meet that 3% variance question.
Thank you. Supervisor McGordy.
Good afternoon, Kyle. It's nice to have you with us. And I just wondered if you have any thoughts about diversity as we try to create some level of equity in our redistricting process, and if there's anything that stands out to you that you think needs addressing.
Yeah, I mean, I generally feel like there is a larger Latino community than you would think was there kind of on a daily basis, watching the way the politics function. I do speak Spanish, and I would try to use that to try to get some more opinions about what things might look like. I wouldn't claim to understand how you're supposed to weigh those two questions of kind of including enough of minority groups into a district to empower people, while at the same time kind of spreading it out. It seems like there's sort of, that's what I guess I find fascinating about this redistricting process, is it's definitely a question of competing goods. And there's each one of those would be of benefit. But definitely making sure that the districts aren't done in a way that disempower any sort of diverse communities, I think would be a way to start with it. And if there is a way to be redrawing lines that would empower more diverse communities, I think that would definitely be something to try to figure out. It's not something I would claim to have any insight to at the moment, but it's also something I haven't paid attention to until a couple weeks ago.
Thank you.
Okay, do we have any additional questions for Mr. Farmer? Not seeing it. Thank you, Mr. Farmer. And you can stay in the waiting room and we'll go on to the other interviews.
Thank you.
Okay, then it looks like we have next is Brian Klavatsky.
Good afternoon.
We hear you. Yeah, we hear you. Maybe you could introduce yourself
My name is Brian Klofsky. I've been living in Mendocino County for 7 years. Currently from Detroit, Michigan. Before that, spent most of my life doing retail management for athletic events at Michigan State University. I was moved out here to run the bookstores at Mendocino College, and then that company sold all of their bookstores to an even larger company, so I resigned after a year. It wasn't a good fit. Ended up working for the county. Been working for the county. It'll be 5 years this fall. Currently serve as HMIS administrator for all homeless services in the county. I'm also very active with SEIU 10-1, serving on the contract negotiating team. I've been on the e-board, as well as the labor management committee between the county and the union, and serve on several committees for homeless services as well as whole person care.
Okay, great. Well, thanks, Brian. Supervisor Hashak, do you have a question?
Well, I'll ask the same question. Brian, do you have any particular change that you would like to see in the redistricting?
I've got no particular changes, just ensuring it's a fair process. I mean, nationally, there's a lot of concerns with gerrymandering. I don't think in Mendocino County and these districts it's as big of an issue, but you also want to be equitable with racial analysis, not segregating one district to include too much of one racial subset, to where that racial voice only lives under one supervisor and they don't really have as much to say in the county if you start moving boundaries that way. I don't suspect that's the way it's going to go, but wanting to be fair and equitable with the process is certainly what draws me to a limited committee like this.
Thank you.
Great, thanks. Supervisor McGordy, do you have a question?
Oh, same question as our last candidate. And I'm curious, and you've kind of addressed this already, is how do you view diversity in terms of redistricting, and how would you approach it?
Again, yeah, you would want to make sure you're not drawing district boundaries that kind of are racially divided. You have seen that historically in the United States. I'm also the care and shelter team leader for Mendocino County, so I set up and operate shelters during evacuations and fires. I've been to every census designated area in the county, so I've seen a lot of it. I'm fairly familiar with all the districts and the smaller cities and towns within them. So making sure you're able to listen to those communiques and advocate for those needs and have boundaries that represent what's best for those communities and the county as a whole. Racial parity being a big part of that. It gets especially tricky, I think, with tribal lands and where they end up on the map. Even though they're federal lands, you still want to have those voices as part of the conversation, given that it's our largest percentage of racial disparity in the county, as well as your Hispanic populations on the ethnicity side.
Thank you.
Okay, thank you. Looks like we have no more questions, so we will go on to the next applicant. Thanks, Brian.
Good day.
All right. Is Peter McNamee in?
Can you hear me now?
Yeah, and Peter,
Okay.
if you could just describe yourself a little bit and why you're applying for this position.
Well, thank you. I have lived on and off in Mendocino County for close to 4 decades, maybe 5. I actually went to high school in Willits, so I have some experience living in the 3rd district. For about 20 years, I owned a home in the Anderson Valley in Navarro. So I have about 20 years experience in the 5th district, and for the past almost 15 years now, I've owned a home in Fort Bragg in your district there, Mr. Chairman. So I have quite a bit of history in the county. I've had an opportunity to live in a number of the areas in the county and experience what life in those areas is like, although it's been a long road. So the county has changed and evolved in many ways during that period of time. In terms of my background, I have been a career public servant for over 40 years. I retired about 15 years ago, but I've continued to remain active in the community and in civic affairs. I have a baccalaureate degree in public service and political science from UC Davis and a master's in public administration from Harvard University Kennedy School of Government. I spent 8 years as an elected official as a county clerk and recorder in Yolo County. And in that capacity, I was the elections administrator. So I had a familiarity with the reapportionment process in terms of how it impacts jurisdictions, and went through that process in that capacity. I have also worked for the Secretary of State's office and the Fair Political Practices Commission in the course of my public service. So I have a background in government, and I understand the implications, I believe, of how reapportionment has an impact on the operations of government. I would say what attracted me to apply for this is a lifelong commitment to good government. It's not just a slogan for me, it's a career, and it's something that I think is definitely impacted by the reapportionment process. We have a fair and equitable distribution of population, and district boundaries represent our communities. It strengthens our democracy and makes our whole system of government work better. So that's what brought me to make my application for this particular appointment.
Okay, thank you for that background. Supervisor Hatchak, you have a question?
Yeah. So Clyde, thanks for applying. And do you have a particular change that you would like to see?
No, actually, I think that, like the other people who you've already heard from, I think the county's relatively stable. There hasn't been a large shift in populations. What I think we're going to find when we dig down into the numbers is there may have been shifts within districts, and that we'll have to accommodate those. But I think I have no sense that the districts that we currently have are in any way inappropriate in representing the district in many ways. I'm certainly open to hearing if anyone feels that that's the case, and I'd like to see alternatives. But, and I think that's the purpose of having a citizens advisory board, to advise the board in that capacity, is to solicit that input and see where it goes. And I'd certainly be interested in following that discussion. But I don't have an agenda or see a malappropriation of the districts as they stand today.
All right, thank you.
Okay. Supervisor McGordy, you have a question?
Good afternoon, Mr. McNamee. So you share one thing in common with my daughter. She's a Kennedy School grad too, so they're around. So I've asked this question of the other candidates, and I'm going to modify it slightly. So how do you think that diversity and kind of difference in psychographic, demographic features should affect districting?
Yeah, I think it really boils down to kind of two tests. One's the legal test, in that the courts have been pretty rigorous in enforcing reapportionments that protect minority communities from being artificially segmented by gerrymandering in order to diminish their voice in the political process. And that legal test has, of course, to be met. But I think there's a bigger test which has to do with the integration of the community as a whole. And by that, I mean that we're strengthened by our diversity. And we have to respect that diversity, and we have to understand how it interrelates into the operation of our government. And I think from that standpoint, we have to be concerned that we don't diminish the voice of people by drawing lines that divide communities that otherwise probably should be held together.
Thank you.
Okay, well, thank you, Mr. McNamee, and we will go next to Deanna Pallison.
Good afternoon. Am I unmuted? I'm not sure.
Yeah, we
Okay,
hear you. So
great,
you could introduce yourself and just talk a little bit about why you'd like to be on the committee.
I am Deanne Pallison, but please, you can call me Dee. I believe we should all participate in our government as much as we are able. And for most of us, that means showing up to vote. Recently, my husband and I have been looking for ways that we can participate more, and this seems even more important with all the current issues that we are all dealing with, both locally and beyond. This committee felt like a good place for me to start. And it is an issue that I feel strongly about and have thought about quite a bit over the last few years. While I understand that county code states that supervisory districts are mainly to be based on population so that all are as equal as possible, I believe there are other important factors that should be considered whenever possible to ensure fair and knowledgeable representation of every resident. I've been a resident of Mendocino County for 33 years. I've lived in Ukiah Valley, Redwood Valley, Willits, and Fort Bragg, 4 of the 5 districts. I've lived in subdivisions and in rural areas requiring us to be completely off-grid. I survived the Redwood fire while my home did not. I currently live 5 miles out Parducci Road, very rural and very off-grid. I have also been a government employee for 34 years, including 18 years with CAL FIRE and now 15 years with the county. I think this allows me to bring an understanding and insight being a part of these 2 organizations afford.
All right, well, thank you. Supervisor Hashak, you have a question?
Well, yeah. Hi, Dee. So do you have a particular change that you would like to see?
I have a concern. I don't know if the right thing would be to actually change it, but I think I would like to look at the different areas that are included in each district to make sure that a supervisor is able to represent his or her constituents fairly. An example of that is where I live now, which is Parducci Road. We're in District 5. We're part of the Ukiah Valley. If we looked at everything from the environment to tourism, Parducci Road has very different needs than, say, Gualala. It's unfair to assume or even expect that the same supervisor would be able to serve both areas appropriately. It's just too broad. So I think that's something we should look at, and District 5 isn't the only district that's affected by that. And I think that's important so that all residents feel like they have a voice within our supervisors.
Okay, thank you.
Supervisor McGorty.
Hi, Dee. Good afternoon.
Good afternoon.
So thank you for that. I've wondered the same thing. We certainly have some districts that go all over the place, and they can't be easy to represent. But my question has to do a little bit with diversity, both in terms of racial diversity and also sort of psychographic, demographic diversity. How do you think that plays into redistricting?
Well, I think it's important that representation of the population of the district is our focus. We don't want to make a decision that isolates any population or any demographic. So if it looked like that was happening, I would think that that would be something that we would have to look at in depth to make sure that all demographics have a fair representation across all districts so that everyone has a fair voice. But I don't think it should be the number one thing we look at. I think we need to look at the community as a whole.
Thank you.
All right. Well, thanks, Ms. Pallison. And next we'll go to Paula Cohen.
Ms. Cohen, you can go ahead and unmute on the bottom left side of your screen, or if you're on the telephone, you can press *6 to unmute yourself.
All right, can you hear me now?
Yes.
You can hear me.
Yes. So if you could just introduce yourself and talk a little bit about why you'd like to be on the committee.
Sure. All right, my name is Paula Cohen, and I have been a resident of Mendocino County for a little over 30 years, living on the coast in Little River. For more than 20 years, I was the executive director of the Mendocino Coast Clinics and was obviously very involved in healthcare and in the way that healthcare was distributed and the funding and grants that we received from the federal government. In addition to that, I was an appointee to the Health and Human Services Agency committee for the 4th District for many years. I'm also the board appointed community member for the Partnership Health Plan Board, which is our Medi-Cal managed care group. I was the chair of the Mendocino County Complete Count Committee, which took on the role of outreach, education, and encouraging people to complete the census. So to me, this is kind of part of the finishing of that loop. Now that we were able to get out and get people counted, now to finish the rest of that process. One of our big selling points was we need to be counted because we want to be represented, and we want to make sure that we're represented adequately throughout the county and throughout the state. So those were kind of some of my motivating factors. You know, looking at our community as I have for many years, and looking at the inequality, especially in healthcare and a number of other issues. I think it's important for us to be able to get in and really find out some of the issues that are in our communities and see how we can encourage local community members to participate more in government and in shaping things to make sure that they get what they need. You want more than that? Currently, I also sit on the Community Foundation board and am a member of the League of Women Voters, who has one of their objectives for the year is redistricting. Last year was the census, and this year we're really focused on redistricting in our communities.
All right, thank you. Supervisor Hashak has a question.
Hi, Paula. Yes. So is there a particular change that you would like to see happen?
Is there a change? Not if you're talking about drawing the lines and redistricting. I don't have any preconceived ideas. I've been looking at some of the maps. I've tried to avoid making any assumptions. The change I would like to see is that we find a way to get more community members interested in government at all levels. And if by getting out there and having public meetings and talking about just redistricting, if we can inspire other people then to be interested in either volunteering or helping with other projects, to me, that's the win. The more we're out there, the more we're showing that we want to the community to be involved in whatever we've got going on, is kind of my personal goal, just to engage community members in government all the way around. Very simplistic, I know, but
Okay, thank you.
Supervisor McGordy.
you're welcome.
Hi, Paula. So I would like to ask you a question of how you see racial diversity and psychographic demographic differences affect how you would redistrict.
How that would affect redistricting. I obviously getting out there and finding out where our communities are, of either the population, language. I think the other part of those issues is also the age demographics that we have going on in this county, are important. As to anything more particular than that, as long as we've done due diligence in getting out there and inquiring and making sure that we meet all of the guidelines as far as numbers of people and districts and inclusion. I'm pretty much happy. I don't have anything that's probably much more specific than that. Just knowing what the guidelines are, refreshing ourselves, and getting out there and letting the community know what the guidelines are, and really listening to them. I think a lot of people feel that their voices aren't heard, and I think this is another opportunity for us to do that.
Thank you.
Okay, not seeing any other questions. We will take this back to the board. Well, I guess first, we should ask if we have any public comments.
Excuse me, Chair Jordy, we actually do have one more applicant on the line.
Oh, okay. Wasn't where?
Mary Zayati.
Good afternoon. My name is Mary Zadie.
Yeah, we hear you. Please introduce yourself and explain why you like to be on the committee.
I am a resident of Mendocino County, Brook Trail, and have lived here about almost 20 years. I have past service history, a long history of serving my community wherever I'm at. My past service history in Mendocino includes 12 years on the Community District of Brook Trails Board. In terms of profession, I just retired this June after 19 years as a women's health nurse practitioner for a Mendocino Community Rural Health Clinic. Had to give up my other civic activities due to working age and my mother's needs before I retired. Now that I'm retired and I no longer have that responsibility, I want to re-engage again into the community service. This committee, I think there's a lot of pertinent issues going on in the country that says stop and review. Look at your numbers, look at your past numbers to see diversity, to see geographic areas. We have watersheds, we have areas with certain particular needs of potential disaster. And I think those should certainly be looked at closely and reviewed. The last speaker spoke up on ageism, and certainly I think that's an interesting topic to look at, that you lay out the past, you lay out what you currently have, you open it to the public and see what comes forth. And I don't go in with pre-existing ideas.
Thank you. Supervisor Hashak, you have a question?
Yes. Well, thanks, Mary, for applying. And I guess that last statement goes along with my question. Do you have a particular change that you would like to see?
I think at this point I have a need to review data with what's going on in the state and in the country to be sure that diversity, that age, and that also geographical area makes sense in districting. Other than that, I don't have a preconceived idea, but I would like to look at those particular areas. I think certain watersheds, certain areas with certain risk, certain areas that have need, urban versus rural, that warrants looking at.
Okay, thank you.
Supervisor McGordy.
Good afternoon, Mary. You've answered some of my, or touched on some of my question, but I just wondered what is your opinion of racial diversity and psychographic, demographic differences? What role those play in redistricting?
I think you have to listen to your community to see if they feel they're being served. Then you have to look at the numbers and see. I think in this era that it's important to review that data and to be certain that representation is available for that area and for those people. I do not think you can just stand on the history. I think you need to look and see, are we meeting those needs now?
Thank you.
Okay, well, thank you. I'm looking at the clerk of the board. Do we have any other applicants or members of the public wishing to address this on this agenda item?
There are no more applicants and there are no public comments.
Okay, well, the item here before us is to appoint a 5-member community-based advisory redistricting commission. Would any member of the board like to speak up in favor of appointing someone? I think it's probably helpful for each of us to, if there's an applicant who's from our district, we might speak up for that applicant first. Supervisor Hashak.
Well, thank you, Chair Judy. I just think that we have an incredible group of people here today. 6 people that are very capable, and I could select any one of them. And so it's unfortunate we only have 5 seats on it. But I think Mary Zadie from Brook Trails, represents the 3rd district. I think she's the only candidate from the 3rd district, so I'd like to put her forward.
All right, thank you. Supervisor McGordy.
I want everybody. They're all really good. But since we can't have everybody, I particularly want to have Kyle Farmer. He represents a younger voice, and in addition to that, he's from the 1st district, and he also represents an agricultural perspective and natural resources perspective, and he's my choice.
Supervisor Williams.
Yeah, I want to add everyone as well. I think the continuity is important to me. I think Paul Cohen can carry that forward.
All right, thanks. Supervisor Mulhern.
Thank you, Chair. It certainly is a bit of an awkward process to have 6 members for or 6 applicants for a 5-member body. And, the intent of the board is to make sure that these meetings were very open to the public process. So I certainly hope that anybody that had applied and also anybody that's not on the official 5-member roster absolutely participates in meetings and gives their input. And I would like to put Dee Pallison forward, please.
And there was a number, all the applicants were fantastic. I would like to see Peter McNamee on the committee as well. He has lived in 3 of the 5 districts over the years. He currently lives in the 4th district and brings a wealth of information as a former county elections officer in a different county about the election laws. And so I think he would bring a lot to the committee. Would someone like to make a motion?
I'll make a motion to approve the candidates that we've selected with our 6th candidate as an alternative.
And I'll second that.
All Right, can we have a roll call?
Can I please get verification on who the second was?
Supervisor Haschak.
Got it. Okay. Supervisor Mulhern,
Yes.
Supervisor Hashak,
Yes.
Supervisor McGordy,
Yes.
Chair Jurdy,
Yes.
and Supervisor Williams.
Yes.
The motion carries unanimously.
All right, well, that takes us next to item 6B, which is discussion possible action, including direction to county staff to continue work on necessary steps to implement the county service area 3 benefit pilot program for the Sherwood Road area. Determine and designate appropriate department for oversight, approve and authorize expenditure of designated funds in the planning and building budget for contracting up to $15,000. And acknowledge land improvement budget unit 1910 as expended $20,000 in staff effort to date, and anticipates that an additional $20,000 to $40,000 in staff effort will be required to complete the process for a total cost of $60,000. And this is being brought forward by Supervisor Hashak and myself. Supervisor Hashak, would you like to introduce the item?
Yes, thank you, Chair Jurdy. So there's been an incredible amount of work done on this over the last couple of years. And, Howard DeShiel, Director of Transportation, has done and stepped up and really helped out in moving this project forward. It's just that there's a few decisions that we need to make, and there's an additional cost. It's a pilot program. We didn't know what we were totally getting into, but we're working those things out, and it's just costing a little additional, some additional amounts of money, and it's requiring more time than we thought. And so I think that Howard might have a way of laying out the decisions we need to be making, and I really appreciate his work, and Steve Dunnicliff and everyone from the executive office who's contributed to this, and the pro bono work we've gotten. So if Supervisor or Chair Jurdy would like to add anything, or Mr. DeShiel, that'd be great.
We do have Howard in the meeting. Howard, would you like to add anything?
Yes, so good afternoon, Mr. Chair, ladies and gentlemen of the board. Can you hear me? Yes. So I'm going to try the share screen. I hope I do this right. Oh boy, screen share. There, can you guys see a map? Okay. So this was the map you looked at when we did the presentation in January when the project started. And the way we put that to the board was we were looking, the lots that are colored are actually improved. And, one of the things we told the board we do is look at this assessment. And it was to do maintenance on the 2 roads that are shown in red. And I don't know if you can see my little cursor running across the screen, but the 2 roads down here that are private roads that we have licenses to use. And we would ask the folks in the colored lots to entertain an additional tax assessment. And then I'm going to try to go to the other map, kind of a decision for today, which is the thought now is that we should choose a boundary, that's the red line, that is kind of inclusive of the whole area, except the parcels that aren't colored, that aren't improved, would get either no assessment at this time or something really small. But that's something we wanted to discuss and at least let the board know, kind of a change, as well as the cost that Supervisor Hashcheck explained. And then, going back to looking at the 2 roads, there's been some discussion. I guess I'd ask County Council to weigh in. In January, County Council had indicated that it might be advantageous to get something more permanent and written in title for the roads that we would be using money to maintain. And because there's been kind of a recent landowner change, and there could be a chance of a new owner, maybe not giving us license, that I thought those would be good things to discuss. So I'll just leave it at that and take questions, and let Supervisor Haschek weigh in more on that. If I can figure out where my mic is.
Okay, great. Do we have any questions from board members?
Thank you both for the effort. I support it.
Supervisor McGordy.
So we have a couple of letters here from LAFCO, and I just wonder if Christian Curtis could weigh in on whether we should be concerned and postpone this as UMA is requesting, or are we okay to move forward?
If I would respond through the chair, I actually spoke to LAFCO's attorney after that letter came in and before this meeting. He had indicated to me that he didn't think that there was a need to postpone these actions at this time, just to be aware that LAFCO needed to be going through some of the process. Apparently because CSA wasn't particularly active back in 2009, 2010, they never did a sphere of influence and some of the other required documentation. So they need to take some steps there, but he thought it would be a relatively quick process.
Okay, thank you. And I just think that this is a very interesting way to address escape routes, which in my district there's some places that need something similar, and so I'm very curious to see how this plays out. And I guess we've already had kind of a test run of it of sorts from last year's fire. So Supervisor Haschek, if you have any thoughts about that, I'm curious to hear them.
Well, thank you, Supervisor McGordy. That's certainly last year with the Oak Fire, the Furco Road, which you see on the northern red line, was critical in getting access into the fire and the ability to use Sherwood Road as both lanes going out from so the evacuation was, as Sheriff Kendall and OES have said, this was the best evacuation they've ever seen. And so I think we saw immediate fruits from this effort. And what we want to do is keep these roads, maintained at that level so that we can access them. And I would like to do, just recognize Rich Padula, who is the owner of land on the Furco Road and on the Willits Creek Trail. And he was a signer of these MOUs in part. He was one of the owners. And really his efforts were for collaborating with the county were really commendable. And I'd just like to recognize that he passed on in late July. So I want to recognize his contribution.
And Supervisor McGordy, Supervisor Haschek and I did attend meetings as an ad hoc committee in your one of the neighborhoods in your district, Deerwood area, and we're well aware of the need over there for a similar route out. At the meetings we attended anyway, the route wasn't really identified yet at that point, hoping that through more planning process, a route could be selected and this model could be duplicated in that neighborhood as well.
Yeah, well, it got put to the test this past week when we had a fire that started near the Ukiah water treatment plant and burned down towards Regina Heights and Vichy Springs area. And fortunately, Ukiah Valley Fire Department, CAL FIRE, and the Sheriff's Office were very much on top of their game and quite amazing at stopping this. The other thing that helped out a lot was there was a vineyard in between the fire and everything, and vineyards don't burn that well. And there was a very nice frost protection pond where they were able to scoop up water and dump it on the fire. So it worked out well. It could have been really bad. So this may be a solution to long-term problem for that area.
Supervisor Hatchak.
Thank you, Chair Judy. I totally agree with what both you and Supervisor McGordy have said, that there is a critical need in the eastern hills of Ukiah. And I don't know if we want the ad hoc that Chair Judy and I are on to deal with that, or if we need to form another ad hoc or whatever. But I do think that we do need to put some serious attention into that and looking at that, coming up with another, whether it's a bridge across the river during the summertime or what. But I think that there's focus that needs to be put on that area.
I would support the current ad hoc continuing.
I would as well.
Okay, great, thanks. Do we have any public comment on this agenda item?
Yes, we do. We have one, and it's Mr. Keith Rutledge.
Thank you very much. Keith Rutledge, Sherwood Firewise. Really appreciate the efforts. This has taken quite a while to get to where we are. Sherwood Firewise was started with one of our major goals was to see the reopening of these emergency access routes, which were on the evacuation routes for dozens of years in the past. So it's really important that we keep moving, and County Council, the ad hoc committee, have been, and Howard Daschle with Department of Transportation, have all been just wonderful to work with. County Council has done a tremendous amount of work with the pro bono legal services that Sherwood Firewise was able to bring in, which was tens of thousands of dollars worth of work that was donated there. And of course, we got a $10,000 grant from the Community Foundation as well. That helped pay for the NCRM work that they did on defining what needed to be done to maintain these routes. Good news is they're both in very good shape as far as the road bases, and so vegetation is mostly what we have to do. The Furco route was cleared under the governor's emergency program, so we got that cleared. And again, great that it was cleared before the Oak Fire. Sherwood Firewise has received a grant from CAL FIRE to do a bunch of roadside work on Sherwood Road and some other roads and brook trails. That will include the Willits Creek emergency access route. And I just got the report that we're finishing up the archaeological work on that, the CEQA work. So we should get a clearance to be able to perform that work soon. And we have the funding to go ahead and do that vegetation management to get it opened. And once these routes are both open like that, they should stay in pretty good shape for quite a while. But as Supervisor Hashek's mentioning, the whole point of this is to keep them in good shape. So it's not going to take much money, a little bit of work each year. But it was one of the reasons that they were considered abandoned, was that nobody had done any maintenance work in the various years in between the emergencies that we've had. So really want to stay with it. We do think there's something for the rest of the county communities. There's plenty of options of ways to go, but we do want to see this. This is very important for our community. Huge risk up here of loss. Everybody knows that. So thank you again for keeping this moving. And if there's anything else that Sherwood Firewise can do to help with making that happen, that's one of our major goals. So please, see if there's anything we can do to help out. Thank you very much.
That concludes public comment.
Take it back to the board. Would someone like to make a motion?
Move the recommended action.
Second.
Okay, can we have roll call?
Chair Judy,
Yes.
Supervisor Hashak,
Yes.
Supervisor Mulhern,
Yes.
Supervisor Williams,
Yes.
and Supervisor McGordy.
Yes.
The motion carries unanimously.
Great. I'd like to take us to the CEO report, item 5G.
Unmute me. Thank you, Chair Judy. This is CEO Angelo. I have the CEO report for today. There certainly are hard copies if any member of the public wants a hard copy, but the CEO report is online. So I'd like to start on page 1 where we have our human resources update, just to remind the staff, the public and the board that we are still offering the supplemental paid sick leave, which is mandated by the state of California. It provides up to 80 hours of leave to county employees unable to work due to certain COVID-19 related reasons. This program is scheduled to end September 30th, 2021. At this point, we don't have any reason or any word from the state that that would be continued, but we're really not certain, as we know our COVID numbers are going up statewide. But you could see within our county system how many employees have requested the special leave and how many for family members, vaccines, and any other reason. And we do keep track of this. And we were running at approximately 50 employees a day that have been off of work in Mendocino County in our organization due to COVID-related issues. The next item on the CEO report is the Oak and August Complex Fire Recovery Update, which we try to give you every month. Debris removal for both Oak and August Complex has been completed as of July, and all sites have been returned to property owners. And we still have the disaster case management services, which are available through North Coast Opportunities. And we do have the phone number for North Coast Opportunities here in the CEO report. There is a budget report update, which is our usual practice that the auditor controller is still working on closing out the prior fiscal year 2021. And the deadline for closing the fiscal year has been extended to early September of 2021. On the next page, you have an update on social services. Actually, we have an update on social services attached to the CEO report. We know that social services has been a division of the Health and Human Services Agency. The one decision that this board made was that social services would be a standalone. So we do have social services working on continuing the development of those services. And so we do have an update here. There is an ag update. I won't go into this unless there are any questions. And then there's a facilities and fleet update and central services. Along with that, code enforcement. And I again want to thank our code enforcement team, because every month they do their statistics and they attach the statistics to the CEO report. And I think that it's very clear as to what's happening. You can see they continue to create new classifications of positions around code enforcement with the division manager and the supervisor. And additionally, there's a central communication hub that will streamline communication between code enforcement and the sheriff's office and the cannabis program. So they're working, really hard to try to improve code enforcement. And I think they're doing a great job. The cannabis cultivation complaints are up 95% compared to this time last year. Responsible parties have voluntarily abated over 18,000 plants. So we could get to their statistics here in a few minutes. Additionally, the budget book update, and as this board knows, there is a budget book that's printed every year. It's still on track to be out in early October, and you can access prior books on the county website. And this budget book, as our other budget books, will be available online and also hard copies. And the hard copy is $60 per book. And I have to say that hasn't gone up over the last few years. It remains at that price. Next page is the American Rescue Plan update. And this is the act that was signed into law in 2021. It establishes the Coronavirus State Fiscal Recovery Fund and the local fund. Mendocino County's allotment is over $16 million. 50% of that money was awarded to the county on Friday, August 6th. So we just received half of that money. The other 50% we will get 12 months from now. And this money there, you can see in the CEO report, all of the funds, how the funds could be used, what they could cover in cost. And you can see that, and also that the fund has to be used by 2026. And there's a breakdown there too. that you can see regarding eligible projects and obligated projects for Mendocino County. Additionally, attached to the CEO report are the directives update. And this is the list that is current as of August 12th. And there are multiple pages, I think approximately 20 pages of directives. So next is a legislative update. And at this point, I would like to introduce our latest Deputy Chief Executive Officer, Judy Morris, who is on the line. And as this board knows, Sarah Duquette had been with us for approximately 7 years. And she was our legislative person in the executive office who worked with the board doing the legislative platform and reporting any legislative updates to this board during the board meetings. Sarah left a couple months ago, and we have had the good fortune of hiring Judy Morris. Judy was with Trinity County for 3 terms as a supervisor in Trinity County. We have worked closely, our board here in Mendocino County, Humboldt County, Trinity County, with Judy and certainly others from the Trinity board. We're very fortunate to have Judy here. She will be working with us with drought, with water, cannabis, fire, and ledge. And those are just a handful of the activities that she will be supporting this county and this board. So at this point in time, with the legislative update, I would like to go to Judy and have her introduce herself to this board and give us a very brief legislative update. Judy?
Great, thank you, CEO Angelo, and nice to see you, Chair Jurdy, and board members. Very interesting to be on this side of the fence, but I'm really looking forward to working with all of you, and we have shared many of the issues together as counties. So just a quick real overview. You saw it in print, some of the legislation that's still in the works in Sacramento. You have AB 970 by Assemblymember McCarty. On surface, it looks pretty handy in terms of planning and zoning for electric vehicles, but CSAC is actually opposed to this because it's actually a redundancy to what is required in this bill. Counties back about 7 years ago were required to do some of the same quick, fast, streamlined processes for electric vehicles. So I'll give you a further update in terms of where that lands in a couple of weeks. The other one I wanted to highlight to you is SB 477 by Senator Wiener. This again is a little bit redundancy in reporting from counties. The general plan reporting that your counties are already required to do. CSAC opposes this unless amended. The next one would be SB 552 by Senator Hertzberg, a drought planning. Of course, that is top of most people's minds these days. CSAC and RCRC are both opposed, again, to some of the redundancy reporting that is going to be required, especially on small water systems. The next one, Senate Bill 556 by Senator Dodd. This would appear to be a broadband bill. It really quite isn't. This too is opposed by CSAC and RCRC and the urban counties. It really allows for, again, a fast track of attaching wireless companies to your infrastructure without a lot of oversight and or financial repayment in terms of using your infrastructure. So at the moment, all those 3 associations are opposed to that. I hate to be my first list with you are all legislation that is opposed, but they're all looking out for counties and cities. And the next one is AB 654, Assemblymember Ray's. This relates to COVID-19. This is a long list of opposition to this legislation in terms of counties, cities being required to list those businesses that have had an outbreak of COVID. You can imagine everybody from CSAC, RCRC, League of Cities, Cal Chamber, Family Business Association, the Farm Bureau, are all opposed to this. Mainly, they don't feel it provides quite the safe benefit that maybe the intention is there in this legislation. They feel it's just a little bit overstepping. Definition of COVID cases is 3 or more for if a business was to have some type of outbreak. So those are kind of the ones that I thought would really appeal to as the county family and to Mendocino in particular. Onto the federal side, there's a little bit better news than on the state side. As you probably heard last week, the Senate passed a bipartisan bill, infrastructure bill, $134 billion. It includes an extension for secure rural schools, which certainly is important to Mendocino County, along with broadband, water infrastructure, of course, transportation issues, including those bridges that are off the federal system that counties are responsible for. So they're looking at extra funding for these projects, including roads that aren't federal roads. So that's the highlight of some legislation. And I'm happy to take questions now or later if you'd like me to pursue something else in more detail on these pieces of legislation. I'm happy to help.
Well, Judy, I'd just like to welcome you to Mendocino County. I and several others had the pleasure of working with you on the North Coast Resource Leadership Partnership Council,
Right.
and which is a 7-county organization dedicated to allocating a portion of state and water bond funds, primarily, other things as well. And so I think you did a great job as chair of that group, and look forward to working with you here in Mendocino County.
Thank you, Chair.
Supervisor McGorty.
Same thing. Welcome, and looking forward to working with you. Your background coming out of a somewhat remote rural county sets you up well to work here in Mendocino, because that describes about 85% of our county. So looking forward to your expertise, and we'll put you right to work on water and drought.
Thank you, Supervisor. Well, I'm looking forward to working with all of you, and happy to meet with all of you, of course, offline, and whatever I can do to help you in the county and ultimately your constituents.
Great.
Thank you, Chair Judy. If there are more questions, I'll wait, and if not, I'll continue.
Looks like you should continue on. Thanks.
Okay, so thank you, Deputy CEO Morris, for doing your ledge report. And Chair Judy, I hope it was okay that we combine the CO report and the ledge report today. The next item is the cannabis program update, and there is an attachment from our cannabis program manager. Additionally, our human resources director is working on positions for the cannabis program, and I think that there may be a position that comes forward either at the next board meeting or the meeting after that. On page 6, there's a drought fiscal report. I would say that the drought task force, under the direction of Supervisors McGorty and Hashtag, has been extremely active, and I'm very impressed with the work that they've done, and certainly our consultant Josh Metz. And I think that some of the work that we're seeing listed in the media, working with the cities and the cities sharing water or basically providing water from Ukiah to Fort Bragg, I want to say that the task force has been very active, the drought task force, in assuring that these activities take place. While we say that we cannot do a rain dance, we can certainly see the cooperation and the coordination that's coming out of that task force between the county and the cities, and our attempts to provide water to those areas that currently are really in need of that water. So,
see a hand raised by Supervisor McGorty.
Oh, great.
I just wanted to say what a poster child the town of Mendocino has become proud, and it's you know, we've had stories all over the United States and even as far as London about our very picturesque town that is struggling, and certainly there's a lot of public sympathy on our side to find a solution to help everybody who lives there. Meanwhile, that doesn't provide any water, but we're working on it.
Right, Supervisor Williams.
Yeah, since it came up, how much water do you think government will be able to provide to the town of Mendocino between now and end of year?
How much you need? I think realistically, if everything goes as planned, we should be able to provide on a daily basis about 65,000 gallons of water transported from Ukiah to Fort Bragg, and that comes pretty close to meeting the needs of some of the water. And
Thank
yeah,
you.
so we'll see. There's a lot to get through. You'd think it's a simple task, but it's not, because there are so many regulations having to do with first of all moving water, second of all moving potable water, third of all creating the logistics to allow that much water to get into Fort Bragg's system and then into a big tank where it's transferred by smaller trucks. That's kind of the direction we're headed. So, Supervisor Hasjack, you have anything else to mention on this?
Yes, thank you, Supervisor McGordy. I'd just like to add that, I think the board did the right decision in hiring Josh Metz as our working on this water issue. He's been putting in a lot of time and has the knowledge and really is helping us, do what we are trying to do in this county, which is provide water to the coast. And, he's very solution oriented, and working with Howard DeShiel lately has been a really good combination. And so I think that we are going to find solutions in the very near future. And that's what we're here for. And thank you to this executive office too, for everyone who's working on it very diligently.
Thank you. Supervisor McGordy.
We've had great support, and I think the other thing that's good that's going on too is that Josh has done and the ad hoc committee has done a pretty good job of outreach to really all of the county, trying to get a sense of where we are. And while some communities aren't quite as dire as that area between Fort Bragg and Mendocino, there's still concerns. There's still dry wells all over the place. So we're trying to come up with long-range planning, which is part of what Josh will eventually be working on. That's really, really critical as we hopefully solve this immediate emergency of getting water to the coast.
And if I could add, Chair Jurdy, is that Supervisor McGordy and I are also looking at some of the issues involved in water hauling around the county and trying to find a solution to some of these issues that are perplexing. And people are very concerned about whether it's Redwood Valley, Potter Valley, or Round Valley. I think that there's a lot of concern going on about the number of water trucks hauling water all around the county, and we're looking at solutions to that.
All right. Thank you. CEO Angela.
Yeah, thank you, Chair Jurdy. Just to reiterate what Supervisor McGordy and Supervisor Hasjack have said, the county, with all of the rules and regulations, we are unable to proceed with some of these projects until the state approves moving water from one basin to the other, and until the local policy decisions have been made. We anticipate that this will all happen. And I believe it is the August 31st meeting that the drought ad hoc and Josh Metz will be giving a presentation to the board. And that presentation will include some policy decisions that need to be made by this board as we move forward. One of the key areas, of course, that the board will need to weigh in on and actually approve will be around the money that will be spent to do the hauling. So hopefully on the 31st, we will have that presentation for you along with some of the financials on that. So if I can move on, there is an information services update that is attached to this report, and also behavioral health and recovery services. I want to just take a minute and actually recognize Dr. Janine Miller and her team in behavioral health. You heard the hospital speak this morning, giving a COVID update along with Dr. Corin and Dr. Dewan. What you didn't really hear was all of the work that's being done by behavioral health to really assist the emergency room. What we know is that the emergency room is inundated with COVID patients, but they still have other patients. They still have people that are, having evolving strokes and heart attacks and other issues that are coming through the door, and along with our behavioral health clients that are still coming in the door. None of that has stopped with the onset of COVID in the emergency rooms. So in our efforts to really support Adventist Health and to help them and to be as good a partner with them as we can be to serve the community, Dr. Miller has been working on an alternative plan, almost like an alternative care site, where behavioral health clients could be held as they're waiting for a bed in a facility. Additionally, one of the other key issues that has come up is around transportation and using ambulance service. And that is something else that Dr. Miller is working on. So I just want to take a moment. Nothing has been 100% fleshed out. She has been working on this and her team since Friday over the weekend, and they're making significant progress. And again, our goal is to help the hospital take care of our clients, help them with their patients, and obviously relieve some of the burden on the hospital team in the emergency room and elsewhere. So again, I think that behavioral health is doing an exemplary job in pitching in this COVID outbreak and really working as a team with all of our partners.
CEO Angelo, there's a couple comments, I think, or questions from Supervisor Williams and Supervisor Mavorty.
Yeah, should this board be concerned about unnecessary suffering or death as the result of our hospitals being overrun by the COVID surge? Is that plausible, or do you feel like things are being handled?
I think I want to say that Adventist Health is being there, the term overworked and underpaid. I think they're working as hard as they can, for Supervisor Williams, you fight fires. And some of us have worked in emergency rooms before where, you can't take a restroom break because patients are coming through the door. And I think they're working really hard. I think that we are overrun, and it's the nature of this illness. Nobody thought that we would be having another surge, that we would be in this Delta variant. And so are more people going to die? Yes, more people are going to die. We are seeing our numbers go up. I mean, obviously the numbers of sick people, the numbers in the ICU, I've never seen such high numbers in our intensive care units. And so, yeah, I think that we're going to see more loss of life. And that's why we're jumping in and trying to do everything we can to relieve the pressure on the emergency room and the hospital. So no, that we're at a point now, this is the point that we fought against last year when we were, raising the flag and talking about, please do all of these actions so that we can mitigate this COVID virus. And, and what's happened, we've obviously opened everything up, because we've had to. We opened everything up. We're sending the kids to school. The Delta variant is rampant. More people will die. I will say that the hospital and our public health team are working on resources for pediatrics. I think that's our number one concern. Kids will be back in school, and what does that mean? And so yes, and yes, Supervisor Williams.
Is there any action we should be considering to reduce suffering?
I think that, well, it's possible that we may come to you, as I think we will on the 31st, and say that we may need county dollars to assist with this pandemic response. And while we've had millions, and we still have millions coming, there is a possibility that we will have to use money in some of our departments to respond to this latest pandemic. And so we would need board authority for that, knowing that that money would be repaid as we can. I think the other thing is that I will say that when we were in the throes of COVID last year, all of you were out there basically working with the public as best you can, and say what was happening and, making those recommendations that were endorsed by you and that came from CDPH and CDC. And so I think the more that you're out there telling the public what's happening, what's needed. I mean, following the orders around masking, the vaccines, I think it's all education and vital, because we're at a point now where, I think you heard Judson Howe say this morning, and I've heard him say this twice now, 2 days in a row, about we talk about, okay, well, we don't do elective surgeries. Well, the hospital, an elective surgery could be a woman who has a potential of breast cancer and they need to find out that diagnosis. That could be considered an elective surgery, and it doesn't happen because they don't have the nurses or the doctor because they're overrun with COVID. I mean, this is the absolute situation that we did not want to be in last year, and now here we are. So I think any education, any outreach that you can do, I think would be really helpful. And the hospital, whatever they need, I mean, we're right there helping Adventist Health as much as we can, because that's the lifeline, is that hospital.
I think Supervisor McCourty.
Yeah, if you're not vaccinated yet, you're really rolling the dice with the Grim Reaper. I mean, face it, this is pretty serious and quite avoidable. And I'm sorry if I hurt people's feelings, but it's really time. It's time for you to get vaccinated if you haven't done that already. All of the health data indicate that strongly. Same thing with masking. It's a fairly simple thing to do and be really helpful, especially as our kids are going back to school. I'm a true believer in it. I just wanted to shout out also to Dr. Miller for exemplary behavior and problem solving, and also Camille Schrader, who's working closely with her. So it's another part of our healthcare system that sometimes gets overlooked a bit, but they work really hard at what they do.
Right, thank you. You continue on, CEO Angela.
Thank you, and thank you for the questions, supervisors, and for your attention to this. And we will attempt to give you as much information as we can as we reach crisis points. The next item is the press release that went out on August 3rd around the changes within the county system. That press release spoke about Judy Morris coming in as the deputy CEO, which of course this board knows was a position that was vacant that we needed to fill. Judy comes in with over 12 years experience in public service. The press release also talked about Becky Emery, and that Becky would be appointed as the Director of Social Services. Becky has over 20 years experience in public service and county government. Also, the press release talked about Janelle Rawl taking over General Services. Janelle has 22 years in public service, and most of that time was spent either with Clerk of the Board, the Executive Office, or General Services. Steve Dunicliffe, who has been leading information technology through this time of change in the county system. Steve has approximately 10 years. I think I got that. So we have over 62 years of experience in public service in those 4 positions. And so, I'm really pleased about that as I move on and we try to do the work of the county, and as we wait for the strategic plan, which, by the way, I think that the consultants are working long and hard with the county team and obviously with the supervisors on that strategic plan that I'm sure the board will use to make decisions. I think it's really important that as we struggle to fill positions, that we see that we have experienced public servants that are still willing to step up and do their job and everybody else's. And I think the question came up around general services. We know that in 2015, at the direction of the Board of Supervisors, the General Services Agency was consolidated into the Executive Office. And I would say that 2 years between 2015 and 2017 was really not long enough to coordinate those services, consolidate those services, and look to having the expertise to continue. General services is purchasing, contracting, central services, fleets, maintenance. There's a lot of services that are considered general services or our infrastructure. So 2017 on, we've had events, emergency events, disasters, whether it's fires, whether it was our 120-hour PSPS, certainly now with the pandemic. And what we're learning is that these basic infrastructure services need to continue and that we need more support. Just as we came to this board talking about information technology and the possibility of hiring a chief technology officer, we knew that we needed one person to lead general services. And the deputies in the county and the executive office are doing multiple activities, as this board knows. We are responding to every event that has occurred. So it was time to appoint someone to just lead general services, knowing that should the board decide in the end of December or January, when the strategic plan is completed, and this board uses that to define the direction of the county, that if the board chooses that they want general services to be consolidated in the executive office, there's no problem. It's all there. So I think, though, that what we do know is that a lot of these internal services are suffering. And what you see are the departments that we can use planning as an example. There's multiple planning vacancies, planner vacancies that we have, and that impacts the public. Well, what you don't see is the infrastructure, the internal services programs like general services, like the auditor's office. When they have vacancies, the public doesn't see it, but those are the departments that are serving the employees that are serving the public. So it's critical that we have a solid infrastructure in this county. So part of that, and at the direction of this board, we're trying to make sure that we have that leadership in place for those services. So moving on, you have a cultural services update. I'm not going to read that in the interest of time, but you can see libraries, museum. We know that the parks department, which actually is no staff, it's just the service of the parks, that has been moved back to general services. We'll give you more information at a later date. And then Rich Molinari and his team on page 8 provide animal care services update, and as they do every month, which is much appreciated. You could see what's happening with our local animals. And then on page 9, you have the upcoming board meetings. And then of course we have a county holiday on September 6th. I have all the attachments here, which I will go through if this board chooses. But at this point, you have your position justification report, which I believe at the direction of this board, we will be having a human resources executive office presentation to this board on recruitment and retention practices, and look to the board for direction on how we can improve that. And the position justification report will be part of that agenda item, along with the vacancy and recruitment update that you have there as attachments 1 and 2. You have the social services update as 3, and then of course your general services with fleets, facilities, central services next. Code enforcement provided 2 pages of data that you have, and then of course we have the multiple pages of directives. I would like to do actually an agenda item to this board to discuss the directives, because I think we need more direction from this board. There's multiple directives that come out of every meeting. And what happens there is that you have departments that get these directives that may be working on other priorities. So I think that the prioritization of the directives is something that we as staff need. So sometime within the next couple months, you'll be seeing a presentation where we will be going over the directives and asking this board for assistance. You have a cannabis program update, an information services update, then of course, Dr. Miller's behavioral health, the press release, and the ongoing list of boards and commissions. And with that, Chair Jurdy, I am done with my CEO report and I'm open to questions.
Okay, do we have any additional questions at this time? Supervisor Mulhern.
Thank you. Thank you for describing what was in the CEO report. I've been attempting as much as possible to get the information that's in the CEO report out to the community, because I think there is a lot of information about what's happening at the county. Just not everybody reads all of that. So thank you for describing it. For a while there, code enforcement was doing a weekly update about their work and how many fines were levied. And I was wondering what was happening with those. And then the other thing is that the two graphs that they've presented are different. They have different headings on them. And is there a way to get those to be the same every time? It seems like it's shifting.
And can we get it charted over time?
Sure. So Chair Jurdy, through the chair, what I can do is actually, we could ask code enforcement to do, they could do public comment, or just as we consolidated the legislative update with the CEO report, I could have code enforcement at the next meeting when we do the CEO report, or if you want a code enforcement presentation, we could do that. So whatever works. Do you have a preference, board members? Would you like a code enforcement presentation? No, I see.
I don't feel like I need a presentation, but I would love just the raw data. I'm happy to graph it myself. But it's whether it's financial, any numbers we have, I would love to get access to.
Yeah. So we can do that. Actually, I will get a hold of code enforcement after this meeting, and if it's fine with you, I will ask them to just send the email to the board with the additional information. And I would also like to say that, I myself have wondered about the CEO report and the fact that the CEO report does not come out on Thursday. And I believe that this board has already explained, because this is like the latest and greatest news. If something happens Monday afternoon at 5:30, it could go in the CEO report. And I know that there have been some concerns. I've heard them myself from members of the public, that the CEO report has a lot of information. It really is an excellent snapshot of what's happening in the county, and that people don't have time to read it. So I would suggest to the public that if they read it today, they're certainly welcome to come back with questions or comments at the next board meeting. And we're doing our best to try to get the CEO report out on Thursday or Friday of the week before, but it doesn't always work that way. I just have to say that. So I don't think there's anything wrong with somebody having questions and us explaining something that was in the CEO report at the next board meeting.
Thanks. Supervisor Mulhern.
Thank you. I just had one more thing. The list of directives is incredibly long. I have it in hard copy form and goes, way before I was a supervisor. So I'm glad to hear that we'll be having an agenda item to talk about it. And it seems to me that there's a lot of things that are no longer applicable. So I suppose we'll have that conversation when it's agendized.
Thank you.
All right, Supervisor McGordy.
I think it's very important on cannabis enforcement to have actual numbers. Supervisor Williams is willing to take that on as a project. I think it's something we want to see because it's one of the biggest complaints that I think we're facing as we try to move forward with a reasonable ordinance, is that we're not enforcing anything that we have already. And I don't think that's really true. And we want to be sure that we're communicating to the public what we're doing.
That may keep me out of trouble. I would happily take that task.
Right, Supervisor Hashak.
Thank you, Chair Jurdy. So looking at the code enforcement statistics, and it is hard to just get them, the day of the meeting and then try to make sense of them. But, if there were 255 cannabis complaints and then 59 were referred to law enforcement and 43 were referred to the cannabis program, that's over 100. So I was just wondering, do we have any information on what the results of those are? So maybe in the future that the cannabis or code enforcement could say, okay, out of the 59 complaints that went to law enforcement, half of them were acted upon.
So Chair Jurdy, we're attempting to get a hold of John Burks, who could give us that information. But if not, we will get that information to you after this meeting.
Okay, so for the law enforcement and the cannabis program itself.
Yes, yes.
Thank you.
Okay,
Well, whatever they have.
All right. Well, it sounds like this concludes the CEO's report, and we have one item left on today's agenda. It's 5 o'clock now, and that is item, let's see, 5E, discussion possible action, including approval of retroactive cooperative service agreement CSA with the United States Department of Agriculture, Animal and Plant and Health Inspection Services. This is being brought forward by the Ag Department. We had a meeting maybe 4 months ago on this subject. I just want to make clear, recap, it was clear there were not 3 votes to renew the contract. Supervisor McGordy and I were asked by the board and we asked the board agreed to have us meet with U.S. Wildlife Services to see if we could bring back a substantially different contract with them. And after months of discussions with them, we were unable to negotiate a substantively different contract. So to kind of finalize this action, instead of just leaving it hanging, we asked the Ag Commissioner to bring back the original contract, knowing that there were, at the previous discussion, there were 3 votes against the existing contract, and have no reason to think the vote will be any different. But since we didn't really finish that action at that meeting, it's being brought back because this is the only contract we were able to secure from the U.S. Wildlife Services with no changes. So anyway, with that, Jim Donnelly, Ag Commissioner, is here to present the contract with Wildlife Services. Mr. Donnelly, you're muted.
Okay, this is Jim Donnelly, Mendocino County Agricultural Commissioner, distinguished Board of Supervisors and CEO Angelo. The USDA Wildlife Services operates nationwide throughout the states, working with states and counties to reduce conflict between wildlife and man and to allow better coexistence between wildlife and man. The Mendocino County has a well thought out Wildlife Services program that is based on an approved CEQA document. The USDA Wildlife Services program follows the guidelines found with the National Wildlife Research Center that develops non-lethal proceedings to handle wildlife conflict. There's times when non-lethal measures do not work and lethal measures or other measures have to be used. And last year, we had an issue with an invasive species of feral swine. We had more calls in Mendocino County on feral swine than in all the other counties in the North State combined. The non-lethal measure for handling the feral swine is to build heavy-duty fences around properties, and this may not be reasonable on larger properties. Nevertheless, even in heavy-duty fencing, oftentimes the feral swine manage to find their ways into the fields. When they get into the fields, they rut up the fields, causing trip hazards and erosion. It don't seem to matter what type of field they want, any type of ground that has the feed they're looking for. I know one incident in Elk Creek in Glenn County where they rutted up an entire high school football field over one night. Last year, the USDA Wildlife Services had 191 non-lethal consultations with 362 individuals. Excuse me, there were 78 invasive species that were controlled non-lethally, and of those species, 15 disease samples were taken. Last year, we signed a 5-year agreement with Wildlife Services, and we also signed a 1-year work plan with Wildlife Services that operated from October of 2020 until June of 2021. We also developed an online payment program with credit cards for users of the service to reimburse the county through fees for the services rendered to them. Other ways we can reimburse the general fund for expenditures to the Wildlife Services program is through the unclaimed gas tax through the California Department of Food and Agriculture, who reimburses for programs found under the Food and Agricultural Code. And Wildlife Services is one of those programs under pest management. And we expect in coming years to receive a minimum of 50% reimbursement for expenditures for the Wildlife Services program. The Wildlife Service agents are professionals, they're well-trained and they're supervised. They have a memorandum of understanding for cooperation with the California Department of Fish and Wildlife Services. The California Department of Fish and Wildlife issues depredation permits to property owners who are having animal issues. And when Wildlife Services handles those depredation permits on part of the property owners, they make sure that all the conditions on those depredation permits are followed. Any measures that Wildlife Services uses to control animals are approved and found humane by the American Veterinarian Medical Association. Without the Wildlife Service agents, property owners will eventually have to handle the wildlife conflicts on their own properties by themselves. They may hire private trappers who are essentially under minimum supervision from the California Department of Fish and Wildlife. They may be lacking training or knowledge on how to handle the animals. They may have minimum amount of equipment to handle the animals, unlike the USDA Wildlife Services. Oftentimes in counties, when the Wildlife Services is removed from the county, we have an increase of illegal trapping activities, a decrease in non-lethal management techniques, and we often find that the trappers or the property owners will take out a non-offending animal of the same species, and the offending animal will escape and end up causing problems in other areas, or may even return to the same area and cause the same issues all over again. Our current Wildlife Service specialist is well-trained and very knowledgeable. He has very small dogs that he uses to track offending animals and manages to catch the correct animal. He answers calls and responds throughout all hours of the day and of the night. He also responds to health and safety issues caused by wildlife on a local level, and he responds as soon as possible. Thank you.
Great. Do we have any questions for the agricultural director? Supervisor McGordy.
No, I don't really have any questions, but I do have some comments. I may not change any of your minds you've already made up, but I just want to, for the record, lay this out here. I consider this to be a key service and part of public safety, particularly for livestock producers all over the county, but especially in the 1st District. And it was a campaign promise that I made to support Wildlife Services. I got a lot of correspondence wanting to see the program end from different people. Not a single one of them was a livestock producer. How many of you have ever walked in on the aftermath of an attack on domestic animals? Pretty awful. Okay, so we talk a lot about wild animals being killed, but I think domestic animals also count too, and especially so many people in Mendocino County want to live in a rural lifestyle and have things like goats and sheep and cows and all of that. There's a good chance that more coyotes are going to die without a trapper program than with it, because coyotes are not protected. You don't need a depredation permit to shoot them. And Commissioner Donnelly made a really good point about how a lot of times it's certain animals that are causing the takes. It's not all of them, but to a frustrated livestock producer who's lost animals, they'll just go shoot. And it's unfortunate, because I think the coyotes are pretty cool predators and really part of our ecosystem. And I hate to see them needlessly predated by people. depredation permits are still going to happen, so predators will still die. And yet it may not be very effective in terms of how it works out. So the trappers are so much more efficient at this than private citizens are, because it's what they do for a living and professions. So I'll just go for the record that I support extending the Wildlife Services contract. It's a very important feature that we offer service in Mendocino County. I don't want to see animals die either. And I've always said that non-lethal measures are a baseline. That's where we start. It's the very first thing that we do is we try to create a situation where animals aren't easily accessible to predators. And in addition to that, there's all the other wildlife human conflicts that are dealt with by wildlife services, whether it's feral pigs or skunks or you name it. It's really nice to have someone professional who can take care of that. And I just wonder if the rest of the board feels that we're all on our own on this now. We're not going to tackle it as a public health safety issue.
Okay, I see hand raised first by Supervisor Williams, then by Supervisor Hashak.
Yeah, Glenn, in my district, it's probably 10-1 against. There is a split, but it's heavily weighted more than most issues. And I want to acknowledge your points. I do hear them, and you're a smart guy. There may be some validity there. Do you see any possibility of a compromise? If not this particular program, is there one that would meet both needs, that would be seen as maybe more humane, but also effective for the cases where there's no other option? Because a lot of what I hear is not so much the concept. When you look at the single page spec sheet, there tends to be more agreement than when you look at the actual implementation. People seem to be heated about this particular implementation.
You know, there's a long history there, and I unfortunately, people think back 20, 30 years when the program may have been administered differently. And I think that things have changed. I think that Supervisor Jurdy and I kind of looked at this and had discussions to see if we could find some kind of a solution with Commissioner Donnelly, and there doesn't seem to be one. I don't know what else we can do, and it's unfortunate because some animals have to die, and whether they're predators or predated, it's just how things work. We're kind of living in this environment that we're in. So no, I don't have any great answers.
And can you tell us a little bit more about the discussion in regards to modifying the contract? Is the contract with other counties modified in any cases? Is it specifically what we were requesting, or was it just a blanket no to piecemealing services?
Maybe Chairman Jurdy can talk a little bit about that.
Yeah, one of the issues that was brought up in previous discussions had to do with the individual trappers and making sure that the county was comfortable with who the individual trappers were. So we worked with County Counsel's office to incorporate language from other county contracts, which would allow the county to have approval or veto on the individual trappers. And because this is an agreement, as Wildlife Services sees it, it's an agreement and not a contract. It's a difference without a distinction, I think. They were unwilling to have that language in the contract or the agreement. And so we couldn't give the board that option, which we thought might have made the board more comfortable with a Wildlife Services contract. Supervisor Hashak.
Thank you, Chair Jurdy. Yeah, this has been a good discussion. One of the things that I'm bringing forward on the 31st is combining animal care and animal control and into one unit. And we were also talking with Sonoma County, a person from Sonoma County who's doing exclusionary work And so, if we go away from this wildlife services approach, we might be able to shift into another model. And, Ag Commissioner Donnelly was in those discussions with the person from Sonoma County. And so we're just looking at what we can do to provide these services for people who have these, issues with animals, especially urban and rural situations where, exclusionary services might be a better approach. So it's still to be determined, but that's kind of one approach we're working on too.
Thank you for that. And I agree that that's a big component of what an alternative would look like in terms of enhanced exclusionary services. Supervisor Hashak and I visited the Sonoma County Wildlife Rescue Program, which is a nonprofit. Just to recap, they're a nonprofit with substantial financial support from their community. I forget the numbers now, but it was perhaps $1 million a year in donations that they received from some wealthy donors. It's unlikely that we would have that kind of donations flowing to a Mendocino County nonprofit. It's not apparent that that would happen. Nevertheless, I think they offer some good technical support for a program, which would probably be a county program. One thing that we've learned is that the gas tax dollars that go to the ag department can only be spent on services that are eligible services and rendered by the ag department. So while I support the movement of some services over to the wildlife, to the animal care division, it's important to know that we won't be able to use those state gas tax dollars for a service provided by the animal control and care department. Only services that are eligible, that are provided through the ag department or a contract by the ag department, will be eligible for those gas tax dollars. So although this contract with Wildlife Services is for just under $190,000, we're probably only providing about 30% of those dollars with general fund because of the backfill of gas tax dollars and the fees paid by members of the public who use the service. But at any rate, just want to make sure that people realize that if we rebuild a new county program, only the programs and services provided through the ag department will be eligible for those state gas tax dollars. Otherwise, we'll have to use county general fund dollars to provide the service. Supervisor Williams?
Yeah, so if Supervisor Haschak brings back a proposal, should it include putting the program under the ag department? I don't care if if the org chart has animal control under ag, if that gives us a reimbursement rate. Or is it enough that our ag contracts with our animal services?
I think that's an excellent suggestion, and I think that's something that Supervisor Hashak should be working with county staff to see if that's a workaround.
Well, that's exactly what we're trying to do. And we had this meeting with Ag Commissioner Donnelly and this person from Sonoma County, for exclusionary services. And we're just looking at how can we kind of maybe incorporate that a contract with a person such as that person under the ag department so that we can tap into those gas tax dollars.
Okay, do we have any other questions or comments for the Agricultural Commissioner? We've had substantial public comment. Do we have any people who would like to comment tonight?
Yes, we do. First will be Don Littmanson.
Good afternoon, Chairman Jurdy and Commissioners. Can you hear me now?
Yes.
Yes.
Thank you. I just want to emphasize a couple items that were in the letter that I sent to you on Sunday, and I hope you were able to consider. One thing that's really important to keep in mind is that the public will be well protected, even if the county no longer contracts with Wildlife Services. 4 Fish and Game Code sections, 4005, 4180, and 4181, actually 3 sections then, give the public a great deal of authority, such as of the sort that Supervisor McGordy mentioned, to either get a permit that can be given to a trapper to kill an animal that poses a danger or is actually damaging property or harmful to health. This is not hard to have, it's very true, but I need to ask, where is the evidence that there is more killing of wildlife in the absence of wildlife services, or that the average rancher, farmer, or homeowner is less able to shoot an animal that's caught in the act of predation? I don't think there is such evidence. So I don't think there's a legitimate argument on that score. The public, there is a great deal of opportunity to kill wild pigs. That's written into the Fish and Game Code also. I do need to talk a little bit about the Wildlife Services agent in question. He may have small dogs, but he has admitted in a deposition to having killed 400 roaming dogs. There are also great problems with of which you are aware through a lot of testimony and documentation of his relationship with certain people in the county. You have an opportunity here to set out with well-qualified people, apparently in the field of exclusion. I would think that there would be certainly a way to put wildlife exclusion and deterrence within the budget eligible for gas tax relief, and I would urge you to do so. We really can get into something better than we're now doing with the way we treat wildlife. It's very important, given climate change and drought, the effect that those are having on wildlife, and we need to be very careful about killing wildlife unless it's absolutely essential. So I would urge you, please, to vote to terminate the contract, and then that the county look forward into finding non-lethal, locally controlled operations. Thank you.
Rosebud, you can press *6 on your phone, and that'll unmute you and allow you to speak.
Can you hear me now?
Yes, we can.
Oh, thank you. Rosebud Ireland here, wildlife biologist. The accepted science is clearly showing the indiscriminate killing, especially of our native carnivores at the rate we are with wildlife services, results in irreparable loss of biodiversity, 24,000 wild native animals killed by California Wildlife Services, 2020 alone. USDA 190K today is the price tag. It was 170 in March, 12% increase. These are precious county funds that we could be using for much better use, especially during COVID. Throughout the recent absences of wildlife services, once again, Mendo did not fall prey to swarms of rabid animals, etc. We already have CDFW, highly trained backcountry professionals with depredation permits for lions and bears. They assess, follow up, develop progressive programs to educate. They have incredible scientists to deal with feral swine on a biological level instead of only shooting them, respond to health and safety issues. They have declared Wildlife Services environmental impact report very lacking on crucial population data. Wildlife Services are trappers, not knowledgeable scientists here. We already have the Animal Care Services, Animal Control working on localized, not federal exclusion and education for human-wildlife coexistence. And no, wildlife services is not a service just like the fire department. Ranchers are in the private business, need to perform their due diligence to protect their assets, just like any business. The new generation of ranchers and farmers in Mendo who consider a loss under their watch is a lesson learned and a chance to improve coexistence practices. These successful ranchers do not report all these issues Donnelly brought up. They've been speaking to you. Have you been listening? Gallon Batiste, Mark Wentworth, Ruthie King, Adaptive School of Agriculture. They're leading the way to the progressive ranching paradigm. Many multi-generational non-hobby ranchers and farmers handing down knowledge of wildlife's non-lethal interactions to keep alive the vision of nourishing the land that nourishes all and a lifestyle that gives back as much as it takes. Let's let them help us with our relationship to food and ag. Please do not approve the retroactive CSA. Instead, move and approve a 90-day notice to terminate wildlife service. This is inevitable. This has been going on way too long. We have a better model. The new ranchers, they're not even new. They're multi-gen ranchers, and they do not understand this methodology of just killing, and causing more.
Thank you, Chair Jurdy and Supervisors. My name is Michelle Lute. I am the National Carnivore Conservation Manager for Project Coyote, speaking to you on behalf of our Mendocino County supporters and indeed all of our California members who benefit from healthy ecosystem management to which your county contributes. We support science-based modern wildlife management, including and especially ending USDA Wildlife Services ineffective lethal program. I also speak to you today as a PhD in wildlife management, former state wildlife biologist, and daughter of 3 generations of farmers. Wildlife Services heavily relies on a lethal arsenal proven to be ineffective at best and to increase conflict at worst. Deploying a program referred to as integrated wildlife damage management, employees use their discretion to employ management techniques on a case-by-case basis. This sounds reasonable, right? But in practice, Wildlife Services interprets the policy in a manner that allows it to kill millions of native wild animals at the behest of private interests. And it has now been made clear that they refuse to adjust their agreement with the county in a way that might reduce their kills and increase efficacy. So you will hear from them talk of needing every tool in the toolbox and claim expertise in choosing which tools are appropriate. But when you look at the evidence, when you look at their activities year after year, you see a lot of animals killed, but you don't see a reduction in conflict. That's because lethal control methods will not prevent conflicts with humans or livestock and may even increase them. Disrupting coyote pack structures may increase attacks, and the same goes for mountain lions. Exploited coyote and mountain lion populations tend to have younger, less experienced individuals that haven't been taught appropriate hunting behaviors. These individuals are more likely to prey on easy targets like unprotected livestock or companion animals. It's true across the board, except in rare instances, carnivore species do not require management to control growth because their populations are self-regulating. This is driven by social structure and density-dependent factors such as territoriality, predator-prey dynamics, and the carrying capacity of the land to support those populations. There just isn't credible evidence from anywhere in California and beyond that Wildlife Services activities effectively serve any beneficial management purpose. I would be remiss not to mention that the risks carnivores pose are often overstated. Most coyotes and mountain lions do not prey on livestock. According to USDA's own data, livestock losses to carnivores are minuscule, less than 1% of the US cattle and sheep inventories, including vulnerable calves and lambs were lost to all carnivores combined. At a future date with additional time, I would love to discuss the non-lethal solutions that do work. But for now, please do not approve the Wildlife Services Agreement. Thank you so much.
Supervisor Williams?
Yeah, question for Michelle. Are you still there?
Yes, I am.
So Supervisor Jurdy makes a good point that Sonoma County does have a program that looks attractive, but they also receive about $900,000 from donors. What do you see for our county if we don't have that $900,000 or anything close to it? Do you still see the potential for an alternative program being successful?
Absolutely. I know there's a lot of support for it from local folks in Mendocino County. And we also know from a lot of these other examples where counties have canceled their contract with Wildlife Services that an initial investment in new infrastructure, modern fencing and fladry and all these non-lethal tools, requires a little bit of capital investment up front, but it ends up being cost effective in the long term over the course of a couple years. So there are cost share programs. There's lots of different options to talk about how to address those issues and still be more cost effective in the long run and effective at reducing conflict. I think what we'll see when we don't have highly exploited predator populations that are receiving this anthropogenic mortality from Wildlife Services, we're going to have a lot less conflict. We have a few examples where we see how effective that is, and we have to give that a chance to work. And then we see that we don't need to come in every year and waste money on these lethal control methods. When we have stable populations, we are not enacting chaos across the landscape, across these populations and disrupting social structures. So we're going to see that we need a lot less. And the investment in the fences that last a while, and the guard dogs and guardian animals and range riders, and whatever the very local context specific tools are, once we have that investment and we've learned how to implement those on the ground, we'll see that we don't need to continually be paying Wildlife Services that much every year.
Thank you. And Supervisor Haschek has demonstrated his interest in spearheading an effort. Would you be willing to guide the board, but maybe through Supervisor Haschek, on how we could track progress so that we can look back and decide, was this the worst decision we made or was it the best decision? What should we be looking for over what period of time? How do we gauge success?
I would absolutely.
You don't have to answer now, but if you'd be willing to work with him and maybe he could bring it back at a future meeting.
Yeah, nothing would please me more than to work to design some metrics to prove the success of a non-lethal program. Thank you so much for that opportunity.
Okay, thank you. Supervisor McGordy.
Michelle, I like your ideas on data and how important they are. And I'm just curious about something. And within your own organization, how many sheep and cattle producers do you have who are members?
I would have to get back to you about a specific number, but we do have many sheep and cattle ranchers, particularly in California. We even have Kelly Hendricks, who's our Ranching with Wildlife coordinator, who's been a ranch manager for over 20 years, along with her husband. So we have a number of supporters that are implementing non-lethal tools and finding that that's what's best for their operations on the ground in California.
And are they here in Northern California under our kind of different landscape conditions where we have so much cover and so much up and down hills and such? Do you think it's landscape specific where this works, or do you think it works anywhere?
It works anywhere, but you bring up a really good point that it is very context specific. So certain livestock guardian dogs are great in rugged terrain versus close to human residences because they bark more or alert or react in different ways to predators. That's just one example. So yes, very localized tools are needed on the ground to implement these sort of things. It's not a one size fits all solution. But we've got examples across the board, across lots of different habitat types that will address local needs.
As I said, I'm really, I really believe in non-lethal techniques is where you start. And certainly we have producers here doing that, but sometimes things get out of hand. And what do you do when you have a very smart predator that's eluding all of your non-lethal techniques and still taking livestock? What would be your solution?
Well, again, that's context specific and depends on the specific scenario. But when you can target the time and location and individual involved, then you can address the situation. And we're not arguing that there aren't some circumstances where potentially lethal control is needed, but it's on a much smaller scale than Wildlife Services operates. And it has to be very carefully targeted. Their tools and techniques are indiscriminate and they don't target those particular contexts and specifics. So again, it's, you know, it's a hard question to answer because every situation, every operation is different. So it really has to be tailored to the individual operation.
Yeah. Um, just for the record, uh, in this last year, there were 4 permits put out for depredation permits put out for mountain lions, and only one was taken. So I don't want us to characterize this as some mass execution that's going on. And again, it goes back to what I said, is that I believe that most of our ranchers are using non-lethal lethal techniques as much as they can. I don't know of anybody personally who likes shooting wildlife. And I think it's a mischaracterization to say that there is a genocide going on here against wildlife. I don't see that. The people that I know are extremely responsible. And this is really a choice of last resort in most cases.
I appreciate those comments, and I would just respond by emphasizing that non-lethal tools need to be deployed, sometimes multiple tools, and they need to be given a chance over the course of longer timeframes than I've ever heard of wildlife services giving. So I think that's just another important thing to keep in mind, that you've also got the space context to address, but then you also have a temporal context to address as well.
But Glenn, given that you have a different perspective and a lot of ag experience and good questions, would you be willing to work with Supervisor Hascheck perhaps to make sure that whatever alternative program comes back has some confidence that it'll meet the needs of ranchers?
Well, I'll certainly try. You know, I'll try to, again, because ultimately I want to see our livestock protected. And yeah, it's not like the old days where you could turn the sheep loose in the fall and whoever showed up in the spring, it was normally made your money. We can't operate ranching like that anymore. And I think we all know that. But I agree. It'd be great if we could still offer something so that we're not without resources. Again, because I do consider this kind of a public safety issue. It's not as dramatic as saving people, but certainly pets and livestock are important too.
Thank you. Do we have any other public comment, live callers right now?
Chair Jurdy, this is Deputy Clerk Lindsay Doherty. This concludes 10 minutes of comment on this particular item. Would you like us to continue?
If we have any other callers that are on the line, yes.
Next on the line will be John Spitz.
Hello, can you hear me? Can you hear me?
Yes, we can.
All right. You know, I'd just like to correct something Supervisor Jurdy said real fast. You know, the $900,000 that he quotes there, that's for the rescue operation down at Sonoma Wildlife Rescue. Her exclusion service down there actually makes money. So that's a false pretense there. Okay, now I'm going to go with my prepared remarks. There's really only one legitimate reason for there to be a wildlife services trapper in Mendocino County, and that is to execute depredation permits issued by the California Department of Fish and Wildlife. CDFW only issues depredation permits for 2 species, mountain lions and bears, and then only if the property owner can demonstrate to a game warden that they have tried non-lethal methods to protect their property. From 1997 to 2017, Wildlife Services killed on average 9 mountain lions and 13 black bears a year in Mendocino County. The state of California contracts with Wildlife Services to provide trappers to execute these depredation permits. Between 2017 and 2020, when the county suspended its contract with Wildlife Services pending an environmental impact report, notorious Wildlife Services trapper Chris Brennan was still here to execute depredation permits. Basically, Mendocino County's contract with Wildlife Services is for trappers to kill all the other smaller animals that mess with people's property. like bobcats, foxes, raccoons, skunks, and by far and away the most persecuted animal of all, coyotes, killed at the behest of ranchers. Killing wildlife in this way is not only cruel and inhumane, it is completely ineffective at protecting people's property. Doris Duncan of Sonoma County Wildlife Rescue has a lot of experience dealing with human-wildlife conflicts, and she has told this board that if you don't properly exclude an animal from access to your property, killing an offending animal will only lead to another animal moving into the territory. Paying wildlife services to kill these wonderful wild animals that so enrich our lives here in Mendocino County is an ineffective and unconscionable expenditure of scarce taxpayer dollars. I urge this board not to renew the county's $189,556 contract with Wildlife Services and to terminate it at the earliest possible date. I also urge this board to contract with a wildlife exclusion service that can educate county residents on non-lethal means of protecting their property and also help them set up exclusion devices. Wildlife exclusion is now considered the best management practice by wildlife experts and is the direction that forward-thinking wildlife managers are headed. It's time for Mendocino County to enter the 21st century of wildlife management. Thank you for your time and for doing the right thing by Mendocino County's residents and wildlife.
Next on the line will be Devin Jones.
Good evening, Board. Devin Jones, Executive Director, Mendocino County Farm Bureau. The item before you today is the approval of the Cooperative Services Agreement with USDA Wildlife Services to administer the Integrated Wildlife Damage Management Program for the county for 2021-2022. Farm Bureau supports the continuation of the Cooperative Service Agreement with Wildlife Services for the numerous reasons we have presented to you in the past. Although there is disagreement with several public comments made today, we want to focus on a different point. Farm Bureau would like to remind the board that on December 17, 2019, less than 2 years ago, the Board of Supervisors approved the following actions. 1, to certify the final EIR and related findings for CEQA requirements for the Integrated Wildlife Damage Management Program. And 2, to adopt an Integrated Wildlife Damage Management Program, including the authorization for the Ag Commissioner to bring back a Cooperative Services Agreement with Wildlife Services. It is understood that not all of you were in supervisorial roles at the time that these actions were taken, and most likely haven't had the opportunity to read the 900 plus pages of the EIR to attest to the thoroughness of that document. This document was a multi-year process that took up substantial county time and resources to get to the point of approval in 2019. As someone that read the 900 plus pages and was involved in the process of getting the document to the approval process, I personally encourage the board to not let this document go to waste. Today, the decision in question is related to the continuation of the Cooperative Services Agreement with USDA Wildlife Services. There has not been any conversation specifically related to what may happen to the investment into the county's Integrated Wildlife Damage Management Program if the board should decide to not renew the contract with Wildlife Services. If the board's vote today does not approve the continuation of this Cooperative Services Agreement with Wildlife Services, and concurrently gives up the USDA cost share allocation, what options has the board considered to replace the service provider for the administration of the Integrated Wildlife Damage Management Program? Will you follow Sonoma County's model and have county staff provide a more limited service at a higher cost to the county? Over the past several months, has Animal Control developed a program to provide basic wildlife exclusionary advice? Will you just let the time and money spent on the EIR go to waste and not have any program? Is the plan to have constituents just handle it on their own, even though other resources are minimal or non-existent? Farm Bureau understands that there is a substantial amount of emotion and misconception about what an integrated wildlife damage management program can be, or what constituents in the county benefit from the program. However, the rural nature and topography of our county will always present the opportunity for both positive and negative interactions with wildlife. The negative interactions should not be ignored. Not having a viable integrated wildlife damage management program will be a disservice to county residents. Since there has been limited conversation about what options may be available to replace the administrator for the program and at what cost, Farm Bureau encourages the board to renew the Cooperative Services Agreement.
Next caller on the line will be Anne Marie Weibel.
Good evening. Please do not approve this lethal program. I'm encouraging you to adopt a non-lethal and educational service that protects the wildlife in Mendocino County. We can follow the example of many other counties that have humane methods that are not cruel and dangerous to wildlife. For nearly a decade, Humboldt County has paid tax dollars to wildlife services to kill hundreds of native animals under contract. Data from that federal wildlife killing program shows that in the period from 2008 to 2017, wildlife services killed at least 178 coyotes, 54 black bears, 43 gray foxes, 23 mountain lions, 483 raccoons, 880 skunks, and 12 opossums in Humboldt County. My tax dollars should not be used to kill coyotes for ranchers. I sent you a letter last time the issue came up, but unfortunately you were not ready then to vote in favor of caring for and protecting Mendocino's precious wildlife. With your support, we can get this done. Thank you for considering a humane approach. Do not approve this and also cancel it at the earliest possible date. And I just wanted to end with a comment about I really appreciate that you've been hanging in there from 9 o'clock until 5:30 tonight. And I've also been trying to hang in there to be able to comment on this item. Maybe I didn't understand it clearly, but it's really hard to know when this agenda item would actually be addressed. It seems somewhat confusing that, items number 4 get listed, and then some items in number 5, and then number 6A, and then back to 5. And I know you had a long session, 2.5 hours or so for the closed session items, but to the public, when we did at some point get a notice that you would be right back, and another half an hour went by, it's really maybe would work better if it's possible to, at the beginning of the meeting, make clear to the public how things will transpire if possible. Thank you so much. Bye.
And that concludes public comment for this item.
Great, thank you. Would someone like to make a motion? Supervisor McGordy?
I will call for a vote to extend the wildlife services contract.
Well, I would, I'm not going to second it only because there's obviously not a third vote. But my concern is that without the program, and I'm concerned we're unlikely to develop a successful alternative program, but I hope we do.
Well, I would also like to say that, I hope everybody understands that I'm an animal lover, not a hater, and I really love all of our native fauna as much as I do our native flora, and I admire these creatures, and it's only in extreme cases that I would ever think about harming them. And I can see where there's still going to continue to be conflicts, whether we have a non-lethal approach or not, and I wish we had a better solution. That's the reason why I support this program.
Okay, for lack of a second, Supervisor Hashak.
Well, I totally agree with comments being made. I do think that there is, a need for dealing with these conflicts. I just think that the public sentiment is to find a new approach. And that's what I would like to do, combining animal care and animal control, and also looking for an exclusionary service that we can adopt in the county. And there are going to be situations where we do need to have lethal means for dealing with animals in certain circumstances. But I think that the wildlife services contract. So what I'm going to move is that we give the 90-day notice to terminate the wildlife services contract, and so that we can move on to finding a better way to deal with this.
I want to go to the Ag Commissioner. I believe the existing contract actually expired on July 1st, so I don't think there's a need to give a 90-day notice, because I think that there is no service in the county, but I'll go to the Ag Commissioner for clarification. Mr. Connolly, you're muted.
We still have a 5-year agreement with Wildlife Services, and you might want to check with County Council to see if that needs to be removed, or there were notifications sent that we're not going to continue the program. But Wildlife Services has removed all of their equipment, and the one agent left in the county is not working at this time.
So I guess to County Council, since they ceased operations in Madison County on July 1st, do we need to give 90 days notice, or is it a formality we need to do?
We're looking at the agreement right now, but yes, we do believe there needs to be a 90-day notice.
Okay. All right. Sorry, Supervisor Hashak, you were making a motion. You're muted.
Sorry about that. So my motion was to give the 90-day notice to terminate the wildlife services contract, and to really move into a new approach and give our best effort to make, the wild animal care, animal control, and the exclusionary service work.
Supervisor Mulhern.
Thank you. Actually had a question about whether or not the EIR that already exists could be used as Supervisor McGordy and Supervisor Hashak work on a potential new program.
Okay, so I think that question probably is really directed to County Council.
So I think the answer is likely yes. As I recall, the EIR was drafted without any particular program in mind and intended to allow for sort of a range of a few possibilities. That being said, I think we'd want to go back and review in relation to the existing, or sorry, in relation to the proposal, and then just see if there's any additional environmental review that would need to happen.
Would this motion include Supervisors Haschak and McGordy working on next steps?
Sure.
I would second it.
Okay, we've got a motion and a second. We have roll call.
Okay, I just want to clarify that the motion is to direct staff to provide the USDA Animal and Plant Health Inspection Services and Wildlife Services with a 90-day notice that the County of Mendocino will be terminating the Wildlife Services contract, and direct Supervisors Hashak and McGordy to work on next steps.
Yes.
Okay. Supervisor McGordy?
No, but I will help if this is defeated.
Thank you.
Supervisor Hashak?
Yes.
Supervisor Mulhern?
Yes.
Chair Jurdy?
No.
And Supervisor Williams?
Yes.
The motion carries with Supervisor McGordy and Chair Jurdy dissenting.
I do wish both Supervisor Hashak and McGorty well in in developing a successful alternative service. Hope you're successful.
Yeah, lots riding on it.
All order, especially for plant scientists.
Okay, it's 5:55, so unless we have an urgent item for supervisor reports, I'd like us to adjourn the meeting.
Excuse me, Chair Judy.
Yeah.
This is Alice Pearson, Deputy Clerk of the Board. I do want to point out that you directed item 4F from earlier today to come back this afternoon. That item has not yet been taken up.
Okay, great. So, oh,
Yeah.
who wants to wrap up that item?
I would like a 5-minute break, please.
Okay, so it's 5:55. We'll try to come back at 6 o'clock.
Sure.
got one last item, which is 4F, and that is the PG Strategic Investment Fund. And we have an updated item attached that which has the Redwood Valley Grange allocation allotment of $250,000. I see Sarah Pierce and Tim Hallman from the CEO's office. Do you have anything you want to add?
Supervisors, this is Tim Hallman, analyst with the executive office. The change has been made on both attachments A and B, and they have been uploaded by the clerk of the board.
Okay, with that, would someone like to make a motion?
I move approval.
Okay, Supervisor McCordy, was that a second?
No, I actually have kind of some question a little bit procedurally. So I'm not sure that everybody in Redwood Valley is happy with where we're going with this. So I don't know if we can continue it rather than make a move. And this is awful after all the work we've done, but I'm getting a lot of feedback.
Glenn, I'm okay with continuing it in the abstract, but I think we want to start putting some of these dollars to use. There's money in there for fire. We're in fire season. I don't want to see that held up. And I don't think we're likely to make changes to the allocation. Maybe we'll add some more beneficiaries. Would you be okay passing this and then coming back to discuss next steps?
Yeah, I think so, as long as we can make additions if necessary.
We can always spend more money.
Okay.
That's what we do.
Well, in that case, this is a good start, and I'll make a second.
Unfortunately, we don't have the ability to print money. Okay, so we have a motion and a second. Can we have a roll call?
Okay, and just to clarify, the motion is to approve amendments regarding the $250,000 allocation to the Redwood Valley Grange from the PG&E funds. Supervisor McGordy?
Yes.
Supervisor Mulhern?
Yes.
Chair Jurdy?
Yes.
Supervisor Williams?
Yes.
And Supervisor Hashak?
Yes.
The motion carries unanimously.
Okay, so I believe that does take care of the consent calendar items. We do have supervisor reports as requests that we just not deal with that tonight, 6:05, and adjourn the meeting. Is that okay with everybody?
Yes.
Yes.
All right, see you later.
Thank you.